Okay, good afternoon everybody. Sorry we're a little bit late. Before we start, we had a really difficult weekend in the emergency services last weekend. We had some awful fatalities, road traffic fatalities in Craven, and the death of PC Nick Dumfries in Cumbria. So I just wanted to say thank you to all of the emergency services who were involved in those incidents, and of course our thoughts are with the families and friends of those people who very sadly lost their lives. So thank you. Okay, attendance and apologies. So we have apologies from the Chief Constable, Lisa Winwood, but we have Annette here instead, and Simon Dennis. The minutes of the previous meeting are on the website, so anybody can just go and have a look at that recording. And I don't have a list of any actions. Does anybody have a list of the actions? No. Okay, we'll follow those up afterwards. Have we got any questions from the public?
No.
No. Okay, thank you. So that means we can go straight in, Andrew, to your team, if that's okay.
Yes. Thank you very much indeed. So this month's theme is Caring for the Vulnerable, the first priority in the CARE acronym that you've set for North Yorkshire Fire and Rescue Service. I'm joined by two colleagues, Mark Warren and Brian Oakley, and I'll explain the reason for that as we go through. It's effectively so you get the strategic, the tactical and the task-based approach that we take in the organisation. So first of all is to remind people of what the four priorities are: caring about the vulnerable, ambitious collaboration, realising our potential and effective engagement. And over the next 3 months after this month, we will have a theme on each of those to explain where we are at the moment, what challenges we're facing and what plans we have for the future to continue to develop. And below that we have our aim and why it's important. And effectively you expect us quite reasonably to provide services to best protect the most vulnerable people in society and make them safer. And that's important because everybody isn't the same. It isn't appropriate for us to provide exactly the same service to everybody that we come across. It's important that we target the most vulnerable and we use our limited resources to make them safer. Not to the exclusion of anybody, because everybody will and can receive services from us, but it is about targeting where they'll have the greatest effect. The plan says that we'll use data to understand vulnerability and target effort, and you'll hear one of the challenges later is exactly that. Sharing data and getting access to other partners' data to help us identify vulnerability. Providing enhanced service to vulnerable people by signposting to specialist services, and you'll hear lots later on about work over in the Scarborough district and the Scarborough itself, about working with other partners through particular operations to make sure we get a joint response to people. Bolstering prevention activity where response times are longer, and again in the challenges I'll cover that and some of the plans we've got to improve and to ensure that the wider programmes we've got, because we're not only about fire, we're fire and rescue, are delivered to some of the harder to reach communities, which is a controversial term because no one should be hard to reach. It's just our ability to open the door to those people and have them join in and listen. It says we'll achieve these outcomes, and this is really what we're all about in caring about the vulnerable. People will feel and they will be safer. We'll strengthen our partnership working, and you're going to hear some fantastic examples of that later, and get better at sharing data. There's a lovely phrase used by, it was actually the Chief Constable of Leicestershire. It shouldn't have been called the Data Protection Act, it should have been called the Data Sharing Act. And then everybody would have had a different view as to what it was all about, because it's actually enabling legislation, and it ought to be able to make it easier, but we don't always manage to break down those barriers as well as perhaps we might, so there's a lot of work to do around that. Colleagues will be confident and skilled in wider health and wellbeing risks. Again, you're going to hear later on about some of the work that's been done at Scarborough by Brian and the other crews and his own crew, and hopefully we'll be quite impressed by just how adept they are at tackling deep-rooted vulnerability that extends way beyond fire and rescue. And changes in behaviour will reduce emergencies. Ultimately, that's what we need to do. It's people that create our demand, and if people behave in a safer manner, our demand will reduce. So ultimately, that's what we're looking to do. So what are we doing well? We're reacting well. And when we find people who are vulnerable, we are very good at helping them and finding the other agencies who can help them. You need to give me a nudge as to which slide, Matt, because I forget. Is it this one?
Yeah.
I'm going to stop and I'm going to pass over to Mark. Sorry, Mark, I've lost my piece of paper that explained when I was flicking over to you.
No problem whatsoever. So going back to when we react and find people when we make real differences, some of the case studies today that we'll present from across the county will highlight that. But the reason why we're able to do that now is because we've got trained staff. We train all our staff in spotting county lines issues, human trafficking issues, RAP training, prevent training, poverty, cold poverty, all sorts of issues that we train right down to the operational staff at the front line, which is why on a daily basis, unfortunately in North Yorkshire, we find vulnerable people, so we react really well when we actually find them. What else are we doing well? Well, our firefighters and CSOs are all safe and well trained, which means that instead of just going in and thinking about whether or not the people are safe from fire, we're thinking about if we can refer the vulnerable people to other agencies. Our relationship building and leading partners to establish clear pathways to get them to support and to refer. We're a really good agency, effectively, for getting other people on board with the referral process. So in the last 2 weeks, we've gathered another 2 agencies that deal with vulnerable people and have their own data set of vulnerable people, and telling them who they can refer to, and then getting them as part of the referral process in the network so that people get the assistance they need. And what we're really good at is changing rapidly and adapting to new initiatives in non-traditional areas of work. So we have, in recent times, we started doing Operation Ambience, which is a relatively new initiative where we go out and we go to places where intelligence tells us people are vulnerable, and we interact with other agencies and do work. We do Operation Contribute. We have fire appliances wrapped in various initiatives, and then back it up with supporting events. So we're going to have an appliance at Scarborough that's going to be wrapped with mental health awareness, very key to the large amount of vulnerable people we've got in Scarborough area with mental health issues. And then we'll do some events and get some people to assist us and assist themselves really in dealing with people with mental health in the community.
So, I think rather than waiting to the end, can we interject a little bit, if that's all right?
Yeah, absolutely.
Yeah, okay, all right. So you just mentioned there, Mark, about the training of firefighters and CSOs around safe and well. Back in September, we had a PAM where it was clear that, and I understand there's complexities around some of this, that some of the training hadn't been taken up. I think there were 9 watches at the time where that training hadn't been taken up. Is that improving? And I suppose Scarborough's one of the areas in North Yorkshire where the partnership working is particularly well developed. So whether or not what you're saying in Scarborough applies equally to other areas as well?
I think to answer it very plainly, we have a very good take-up for safe and well training in the east of the county, probably a better percentage-wise than other parts of the county. Yeah. However, it is a good news story and it is spreading. So although some of the watches effectively haven't formally had training yet, they're actually doing more and more referrals and more away from just a standard home fire risk check to safe and well visits on their own accord. But I think that's still a bridge we've got to cross to get us.
Okay, and that includes part 2 as well, because that was where there was a slight sort of rub, wasn't there?
There's the link to the role map of the firefighter and the national negotiations around pay and widening the role map to enable a pay rise to be provided. That work is still ongoing, so there is a reluctance in some areas to formally adopt the wider working, which I think is formally adopted and very well established and embedded in Scarborough, will improve elsewhere as that pay issue progresses. Having said that, when we went out for case studies from all of the different districts to show specific examples of how we have worked with the vulnerable, every district was able to provide examples where they've gone way over and above the home fire safety visit through the Safe and Well, and engaged with lots of agencies to make sure somebody very vulnerable with multiple needs was dealt with effectively. But I think Mark's probably right in saying that in terms of being well established and well taken up, Scarborough does seem to be performing very well.
Yeah.
Can I ask a question on how, as opposed to sort of understanding and training around vulnerability, how well you understand the partnership landscape and how well to refer these people onto the right place and be confident that that referral has been received by the right people and acted on, and how you go about seeing that through so that person gets support from someone else, because you might be able to support that person.
So I'd just add to that though as well, because that was obviously something that came out of the HMIC FRS inspection, was around how developed formal safeguarding processes are within the fire and rescue service, and I think they said it was quite an area of concern. So I suppose in terms of your AFI's actions for sort of further improvement, is what you're doing around that to try and sort of improve it.
And I think that will come in the slide, won't it, Mark, when we start talking about what we could do better.
Right, fine.
That's a
I
slide.
can make a very brief one if that's all right.
Yeah.
It's quite a difficult area because we have some really well established referral links for people like living well, safeguarding, sorts real defined links. But if you look at North Yorkshire, there are really good agencies working within North Yorkshire that are local. So one of the referral links that I made within the last 2 weeks was to a lottery-funded charitable organisation that deals with Barracliff in Scarborough, and only Barracliff in Scarborough. So it's a complex issue. You can't just sort of draw a nice tree diagram for the service and say, there you go, Brian, watch manager, that's where your referral links are. Because if you move to the next station along, you have some really good and important agencies that are working that can really help people that if you're not referring to them, you're just not doing the full remit. So it is a complicated area, but I would say that, you know, from a personal perspective, I know that everybody that we interact with, we refer, we don't leave anybody that's vulnerable without having somebody being referred to.
I suppose it's having the formal processes and systems in place, isn't it? So whether or not I don't know, you know, if you're in Harrogate, you've done that assessment of the agencies that are available in Harrogate, and everybody knows where they need to refer people for what, if you see what I mean. So there's a structure behind that, because very often you see it relies on individuals' knowledge and relationships rather than it being a systemic thing, if you see what I mean.
And how does that fit for Scarborough, for example, Mark?
Well, I think for us, we've got a real plethora of people that we can refer to. I think tactically, which is sort of why I've been asked here today as a group manager, what I'm looking at is how we close the circle, because it's no good just referring people not knowing that vulnerability has been removed, or that somebody isn't looking at something else. You know, if there's a crime that's made somebody vulnerable, it's making sure it's closing that loop. So tactically I'm focusing on that. Brian's out there, and as we'll see with some of his case studies, the links to Rainbow Centre or the other agencies that are out there helping people who are vulnerable, you know, at a watch-based level, they know where to go. But all the time I'm searching from my position within the service to try and find more and more people. I found a charity the other week that actually funds people's debts. So I won't say which one it is, but you know, it's that you come across all sorts of really good organisations, but a lot of them are local.
Yeah.
It's really easy just to say we'll just use the county ones, but it doesn't serve the purpose, and why not?
There are some formal mechanisms. There are hubs in various places. There's up in Harrogate, there's a hub in Scarborough, and then there are meetings that take place at the various tiers of leadership where individual cases are discussed, so that there is a shared understanding, and that safeguarding is being dealt with formally through those mechanisms. I'm sure there's lots of other lower level safeguarding issues that are dealt with more simply. I think there are measures in place to deal with particularly the more serious safeguarding issues. But yet that closing the loop bit's important, so that when we found somebody and dealt with them and then referred out to other agencies, we continue to work with those agencies and we don't let go of that person until we're content that they're safe enough.
Yeah, but from an organisational point of view, though, it's making sure, because Scarborough does have good practice.
Yeah.
It is making sure that the good practice in Scarborough
Yeah.
is identified and used appropriately. It might not be appropriate because, you know, Scarborough has a very well developed third sector. You know, other places don't in the same way, but it's learning what's really good and sharing that learning.
And to be honest, we do that when we have various meetings, but one of the meetings that we do have is between the district group managers, and we meet roughly about every 6 weeks, and then what I do is I go, similar to I'm doing today really, go over the case studies and the things that we've done well, share that learning, and then try and roll it out. But it is difficult with North Yorkshire just being such a massive.
Okay, great, thank you.
Just moving on.
Sorry.
No, you're right. No, you're right. What else are we doing well? Well, we've got a skills programme covering road, water, fire and safety. We used to just deliver that in areas, certainly when I started. I'll refer every now and again to when I started because it's 20 years ago. We used to deliver it where we had a whole town fire station. It always used to appear to me to be a funny thing that people at Scarborough schools could have fire prevention training from the fire service, but if you lived at Filey where there was an on-call station, you didn't receive it. And now we do that. We deliver it across, you know, most of the county. We plough resources into making sure that everybody gets the same input. We've got a raft of youth engagement courses and things that we do, from life courses, fire cadet programme, fire setup programme, and they make a real difference and change, you know, young person's lives around doing these courses. And we have station community hubs where we have agencies or charities are using our premises, or where they're using them for things like dementia coffee mornings, and you know, so we're a lot more integrated in the community than we ever have been.
So just on the so one of the things that I was doing this week was I was in London talking to the Early Intervention Foundation, and they administer, along with a couple of other organisations, the Youth Endowment Fund, and one of the things they're very keen on is the evaluation of interventions. And I mean I fund the life course, and we always struggle a little bit with how do we evaluate whether it's good value for money, because you always get a lot of really positive feedback from those courses. The firefighters love it, the kids love it. You know, there's you know, evidence of literally turning people's lives around from having been on those courses. But how do you actually properly evidence that? Because if we could evidence that, there are other channels of funding that we could go to get more money to do more of it. And I suppose that's a sort of a bit of a challenge, really.
I think, that's about where I'm about to tell you about,
right.
To be honest, because we're going to have a case study today where, you know, we can actually evidence that the work that actually Brian did made a real difference to an individual. But part of the challenge, as I'm about to tell you, is that our recording currently may register as one safe and well visit, whereas the actual time and effort and impact that we've done is a really, really difficult thing to measure. Some of these vulnerable people that we interact with, the way we go above and beyond, it's the right thing to do, but being able to show the impact is really difficult. And
you also don't want to burden operational staff with having to fill in lots of forms every time they have an interaction with somebody to do an evaluation. Which is,
It's got to be non-bureaucratic.
Yes, it needs to be non-bureaucratic, but just on that recording point then, and thinking back to a couple of the reviews of fire deaths that have happened recently, how are you recording your safeguarding going forward? So, you know, you're saying at the moment potentially that it's just down as a safe and well check, but then there's a lot of action happening in the background.
Well,
how do you record and track through the process?
We use one system to record just about everything we do in community safety, and it tends to take things in as a job effectively, and then you can allocate time to it, and you can allocate things like number of smoke alarms fitted and stuff like that. But as we go through the case studies, I think, you know, if everybody reflects on what we do as we're going through, it's really difficult to make a system where you can drill down to whether or not you've you've done individual things, because what our staff do is very tailored to the individual. So as we go through the case studies, it's other than recording time sometimes, or number of detectors, or number of visits, it's the impact we really need to try and get a grip of.
There's a slide to come that shows the future structure of the organisation, including a role, area manager assurance, part of whose task is to develop the framework and the tools to enable us to record all of our work and to start to measure the output and outcome of that work. So I'll talk about that in a bit more detail shortly.
So the challenges that we face at the moment, we have a real and perceived barrier with partners in sharing information. So I know it's already mentioned, but GDPR, the mention of sharing information is a real struggle. People, certainly agencies, are very wary that they don't want to break the regulations, and sometimes we find it really difficult to get data sets that could really help us out. We have access to limited intelligence at the moment. We gather most of our intelligence from safety hubs and from partners in the police, from various sources that are informally set up, but actually the intelligence base of stuff that we try and do, it's just not where we should be. The monitoring and measuring of causal effect of our work and public performance, this is going back to exactly what you just said, Julie, which is you can have a crew spend a great deal of time and turn somebody's life around, but then how do you measure that, and how do you monitor it, and how do we show that that impact's happened? And yet we all know in the room that, you know, save somebody's life and save them from taking life in future, then it's a massive impact.
I mean, there are ways of doing it, and I think it's interesting because the Early Intervention Foundation was basically saying that blue light services are not brilliant at understanding how they do that, and actually there's an opportunity with them and the funding that is now available to actually develop those skills, which I think is applicable for the police as it is for fire and rescue. And obviously, you know, health and councils have got more experience of this sort of thing than we have.
And that brings us right back to my very first public accountability meeting this time last year.
Yes,
actually.
it does.
And I apologise to the public for telling them their performance, not our performance. And what I said was our performance was the effect that our work has, that causal effect on their performance. So when we talk about numbers of fires, deaths, injuries, car crashes, deaths, injuries, automatic alarms and rescues, that's the public's performance. Our performance, and what we need to be able to do, is to strip out all of the other factors that are affecting the public performance and be able to say the impact that we had specifically. And that's where that evaluation model will come into its own, and that's why that head of assurance role has been created to enable us to do that, because that will direct so much of our work in the future, because we'll know what works and we'll know what works less well, and we'll be able to redirect our resource to where we know it will have the greatest causal effect on public performance.
So rurality, reaching those most isolated, obviously. We've currently got most of our resources in the largest towns in North Yorkshire, and it's obviously it's a constant battle to be able to deploy our resources and do our work.
So can I just, so again, I want to just pick up on what HMIC FRS said about that, because it stood out really. So most prevention work is done by whole-time crews, typically based in urban stations. So by default, they're more focused on urban than rural, urban than rural communities. So staff at on-call stations do home fire safety checks after incidents, but don't have a programme of work in this area. So, I mean, again, from an organisational point of view, it's really challenging because of the 52% of our resources out there on stations are on call, not whole time. So how we have that impact in rural areas is a big question, really.
I think over the last number of years we've improved beyond sort of that as a black and white picture, because certainly we have on-call stations that are also whole-time stations, and therefore that if the on-call people are available, it gives us the mobility to move your day crew in pumps or out the service and do more rural work. We've got the CSOs, which
community safety officers,
which have improved dramatically how much we deliver. And as I'm going to at some point get onto one of the opportunities, I'll speak probably about the public safety officer, which is,
Yeah.
I think, a massive step in addressing that problem.
I think today, I think that criticism from the HMI is fair. We're not good enough at making sure that our services, our prevention services certainly, are as accessible in the most remote places. And those are the places, of course, that it would take us longest to respond into as well.
Exactly,
So it is
yeah.
important to get into that.
Yeah, and then that leads you to a sort of more strategic question then, is if you've got longer response times in those areas, does that impact on risk and resourcing as well?
Exactly that.
Yeah.
Yeah, and I think we'll cover that, but that's that. So our team of community safety officers at the moment do focus on rural areas. They're drawn into urban areas where you get particularly difficult cases, possibly too often, but as the skills of the firefighters improves, that will become less necessary. But then those very remote rural places are still tricky. So what Mark will talk about is that public safety officer. They'll be able to do the towns and the villages, the rural towns and the villages, and what I hope is able to happen then is those community safety officers are able to focus their efforts on the places that even those public service officers aren't reaching.
Yeah. Okay. All right.
Just going on, what opportunities do we have as a fire service? Impact of the new prevention strategy to maximise use of resources. So we've now got a new prevention strategy which will help us push those resources out to exactly where we've just been saying, the rural and remote locations. Greater collaboration and better use of intelligence. So we're collaborating more and more of recent years, and the opportunity is there to try and get the intelligence if we can guide them through giving us it. Greater use of learning from established information sharing agreements to fast track future partnerships. One of the first data sets we've managed to get from a partner agency took us about 8 months to get through governance groups, internal, external, verifiers. But once you've done it once, you have the model to be able to do it again. So I think what I'm trying to point out is this: once we've gone through the PIM, which I think we have done, I think now we can go back to the other agencies and say, this is the pro forma, please follow suit. Freedom and flexibility to manage risk local under clear direction. So as a district group manager, certainly under Andrew's direction, it is Andrew's direction to give me freedom and flexibility. So on a day-to-day basis, what I try and work out is what's right to do, and then I do it, and then Brian helps me and he goes out and delivers it, and then I talk back through the food chain and tell Andrew at the end what we did.
So can I ask? This is a bit of a cheeky question, but I'm going to ask it. So, do you sense a change in your ability to make decisions locally over the past 12 months?
Yes.
Right.
So I mean, I have a little story that sort of describes it. There's a fire station within my part of the county that puts the Christmas tree up annually for the community. And for the last 19 years, we've always said that it's a training exercise, so that if anybody asks us why we're doing it, it's a training exercise because it's at height effectively. And that if we didn't
Christmas
do it,
tree then.
and if we didn't do it, a member of the community would put themselves at risk.
Yeah.
And in the last 12 months now, we just say no, we're putting the Christmas tree up for the community. So yeah. And
Okay.
I think that sort of answers
Right.
the question.
Yeah. Okay. Great.
Introduction of public safety officers. I think we've actually just covered it, to be honest, but
It's
could
worth
be
describing what that is.
Yeah.
it could be a massive impact. Somebody that's trained to respond to health problems, and somebody that's trained to assist with crime or low-level sort of policing problems, and somebody then is able to assist and respond with a fire appliance in an area where we really struggle to locate. That person, although they'll be wearing effectively 3 hats, if you are certainly in parts of my rural parts of the county now where I struggle to have retained officers, we struggles to get an ambulance in time for certain things, and we struggle to get enough police resources to reassure people when something small happens in a rural village. It has a massive impact on the community. having a person located in those areas will make a massive difference to 3 services, and is also, I have to say, it's a very well liked job at the moment. I seem to get a lot of people asking me about it, because
That's good.
if you think of what people join a service for, like us, myself and Brian, Andrew, we all join to help people. If you can wear 3 hats, you'll help 3 times as many people. So it's showing a lot of interest in when it's been trialled, and people are looking out for it to come across to other areas of the county.
Great, fantastic.
And it makes it affordable for us to have full-time resources, full-time people working in our more remote communities, by sharing the cost of that person amongst multiple agencies. So it would not be affordable for the fire service, for example, to put a full-time member of staff into every one of our on-call station areas. By sharing the costs of that person, it becomes really possible, and actually each visit that person does becomes far more efficient and far more effective, because as well as covering the fire aspects of that, they're also covering the other wider public service aspects as well. And we're not going to limit ourselves to police, fire and ambulance services. We will also look to work with CCGs, health authorities and local authorities to see whether or not they can be part of that as well. So it's a really full offer to a rural community that perhaps doesn't receive that level of offer at the moment.
And I think it's worth to say, Tom, isn't it, that this has been modelled on the programme that they've had, a successful programme that they've had in Cornwall, that we've borrowed and stolen with pride.
Yes.
Yes.
It was one of the primary planks of the governance transfer business case, so it's fantastic.
And it was
to
in
see
Transform
coming through.
2020 as well.
Yeah.
Indeed, yeah.
So good. Okay, great. Okay.
More opportunities that we have. We need to maintain the good relationships we have with representative bodies. I think we probably have the best relationship with the representative bodies, certainly in my career. I remember the reason for that is because we managed to make the changes, but we make the changes with motivated staff. It's obviously opposite if you don't have that. And we have a risk resource model coming, which is a real opportunity for us to have a look and make sure that we have got the resources where they're needed, at the right time, in the right place. And it's going to be a real opportunity for us to change as a service.
And it's worth noting that risk and resource model is our new title for the Integrated Risk Management Plan, which you have to provide, of course, by statute. But Integrated Risk Management Plan doesn't mean a lot to very many people, which is why we've renamed it the Risk and Resource Model, because it does what it says on the tin. It identifies the risk and it says how we're going to resource what we can afford to manage that risk.
Okay, great.
So it's back to me now, Mark, yes?
Affirmative.
So, a couple of weeks ago we had a shared learning week where the leadership and management of the organisation came together for 4 days. There was a 5th day to come of learning. And that Monday morning, it's fair to say that I took it and people got the world according to me.
There's no people laughing.
It was 3 hours of their lives they'll never get back, but nonetheless, nobody in that room could have been unclear about the direction of the organisation from that point forward, and most importantly, their part in it. So this is the model that I am introducing, and it's linked very heavily to the intent-based leadership model that the police use and that we're of course adopting. So it's based on 3 principles and 7 tools. The 3 principles are that accountability and responsibility will be held at their appropriate level within the organisation. Mark will be accountable and responsible for the safety of the people of Scarborough and Rydale districts. Brian will be accountable and responsible as part of the management team at Scarborough for the safety of the people in Scarborough. But in giving them accountability and responsibility, or holding them accountable and responsible, I give them freedom and flexibility to get on and do whatever they need to do to make their community safe, which means that they can identify the specific risk to their area and target that, as opposed to having a generic blanket approach to everywhere, because the risk in Scarborough is not the same as the risk in Reeth or Harrogate or York, and vice versa. So that's really important. And the third element, the third principle that is essential to make this 3-principle model work, is that we then measure and monitor the output and the outcome. By which I mean we measure how much work has been done, of the different types, and then we measure and monitor the effectiveness of that. So that's that causal effect bit. What difference has that made to the behaviour of the people who have received that intervention, and what change has that made to their performance? How much safer are we making people? So those three principles are essential in all working together, because if you take one of them out, the whole model falls apart. So that's been shared with everybody who leads at the tactical level within the organisation, the middle management engine that drives us. And they'll work with 7 tools, 4 delivery tools and 3 enabling tools. And you can see them up there. So what I'm asking is, when Mark or Brian identify a risk in their area, they take accountability and responsibility for that. And then they think really creatively about how they might manage that risk. But they will look at those 4 delivery tools and think, how can we prevent it? What measures could we put in place to protect it once the risk has manifested itself, has happened? How do we make sure that we're best able to respond to that? And what resilience, what community resilience measures can we put in place to help the community help itself while they await our arrival and while we're there? So those are the delivery tools that they will consider when they're coming up with a package of measures to deal with that risk. They've then got the enabling tools, the things that make them able to deliver those prevention, protection, response and resilience services. And that's around planning the work, and planning it very much in partnership with other organisations who are able to identify the vulnerable and help make that vulnerable person safe from whichever sphere of work they operate in. And the performance monitoring, which is back to the measurement and monitoring. When we know how effective something is, then we know whether we should repeat it, expand it, or reduce it, or stop it altogether, because we know that using our resources in other ways will have a greater effect on the public's performance. So that's the model that people are now operating in, and I think lots of this stuff is already done. You'll hear later on some of the brilliant examples of work that we do, but I think this will make it more systematic and a more deliberate approach, a more measurable approach, and therefore I'll be able to give you and the public and the HMI assurance that we are using the resources that we've got to the very best effect. And that's really important that we're able to do that. So that's a significant shift, I suppose, in the emphasis and in the empowerment of staff. So this is a slightly unconventional way perhaps to demonstrate how we work within communities.
I was curious when I was looking at these slides as to what this was about.
So this was a central tenet of that learning week. So we've got the Drogs, the Blogs, Mr. Frog and Trog Industries, and if I describe them, the Drogs are the troubled family, really struggle educationally, there might be a lot of crime, antisocial behaviour surrounding that house. They're a vulnerable family, a vulnerable household within our community. They're vulnerable from fire and lots of other issues, and they also create vulnerability by virtue of the fact of the way they behave. We've then got the Blogs, and I describe them as Joe and Mary. Joe's 78, Mary's 75. Joe's got Alzheimer's, and Mary's arthritis is making it quite tricky now for her to care for Joe. A vulnerable household within our community that we need to help. Mr. Frog is the 62-year-old man who lives alone following the death some time ago of his wife. He lives in social isolation, he smokes a lot, he drinks too much, and he hoards. And we keep finding, the fire service keeps finding Mr. Frog too late, because we find Mr. Frog when he's unfortunately dead on the living room floor because he hasn't been able to escape the hoarding that he's created around him. So we've got to get in there early and work with other agencies to make sure that he can be safe enough. And then Trog Industries represents all of commerce, and of course we have our statutory duties under the Regulatory Reform Order to make sure that those places are safe and contributing to the economy. Trog Industries has got a lot of black smoke pumping out of that chimney, and they're a problem for us because the likelihood of them having a fire is really quite high. We're going to concentrate on them. So they represent the vulnerability within our communities. That purple triangle then represents the community, and at the thick end of that purple triangle I've got the community leaders, the people who know exactly where the Drogs, Blogs, Frogs and Trogs are. They're working all the time in those communities and all the way to the pointy end through the different community groups and networks that exist. We then lay over the red fire triangle. So I'm at the pointy end of that, And the front line of the fire and rescue service, everybody who delivers services, whether it be a receptionist answering the phone to the public, a community safety officer, a fire control operator, a fire protection officer, or a firefighter. They're at that fat end. And the fat end of those two triangles overlap, and I'll explain why. Because there is an interface between the frontline service delivery of the fire and rescue service and the community leaders in that community, and they can identify for our firefighters and our frontline staff where the vulnerability is in the community. Then got a third yellow triangle, which is the local authority tier. And that's where the interface is between you and I, Julia, because at the strategic interface of the elected member and the Chief Fire and Rescue Officer, that's where the strategy is developed about how we are going to, well, what our priorities are set out in your plan. And then in between that, and I've actually added in a more updated version of this, a third interface which fits between those two, and that's those middle managers. They're the tactical managers. They decide how to take the strategy, turn it into tactics, and then how they're going to lead and manage the frontline staff to turn those tactics into tasks that mean that we deliver our services to the most vulnerable parts of our community. And who else do we work with? Well, you overlay the police and you'll see that the Chief Constable is added to that strategic interface. Ambulance and health services, local authorities, and myriad organisations in the private and voluntary sector. And there's an interface at the strategic level there, where between us all we can determine a public sector strategic approach to dealing with vulnerability and delivering services. But there's also a huge interface at the front line, and all of those front line teams, police officers, firefighters, community safety officers, health workers, teachers, doctors, are all able to share information with each other to identify the most vulnerable and to deliver services for each other and together to make sure that they get the best possible service. And again, that interface in the middle, that tactical interface in the middle, is where all the middle managers, the district managers, the people working within functions in our enabling services are able to work together to make sure that the way that we operate tactically enables jointly our frontline staff to work together to identify the drugs, plugs, frogs and trogs and deliver them the myriad services that they need, but to do that together. So that's the ethos, I suppose, of how we're moving forward as a fire and rescue service. It puts the public very much at the top of the tree, and it puts me and you, Julie, funny enough, at the very bottom of the tree.
Quite where we should be.
Quite where we should be, because we exist to deliver the strategy and the priority and the plan that the frontline teams can deliver directly to the public for whom we exist.
Tom, did you have a...
So just in terms of caring for the vulnerable there, in say 12 months' time, how do you see this playing out? What's going to be the difference at the front line of the service in the way that they're engaging with the community in your model there, in terms of supporting those vulnerable people? What are you expecting them to do?
I think what will be different is that deliberate and systematic approach. At the moment, Mark said one of our strengths is being able to react well when we find a vulnerable person. But too often we find vulnerability by chance. I think in 12 months' time, when all of those frontline teams are working very closely together, sharing information with each other, then we'll have a more proactive approach to identifying the vulnerability and then risk assessing what they need, and then going back to the 7 tools, deciding how those 7 tools will be applied, particularly the 4 service delivery tools, to keep those individual vulnerable households safe. That's what I think you'll see, a more deliberate and systematic approach and a more proactive approach to finding the vulnerability, so it's not by chance.
Okay, so an action point then out of this meeting would be to, because to do that, you're going to need to solve some of the challenges that you talked about earlier on, so the information sharing, the intelligence gaps, all of that sort of stuff. So I wonder whether then within 6 months what we need to do is review how well you're getting on with dealing with some of those challenges so that you can make that systematic change.
It's a good idea. What we measure, we'll manage, and if that's something that we know we've got to come back to, that should be a good incentive. To crack on.
And one of the things, I do harp on about this a little bit, but anyway, I will do again, when you're trying to measure outcomes, sometimes you just can't go to the end outcome and measure it. What you need to be able to do is identify the actual things that you need to deliver that you know are going to lead to that outcome. And that's the bit that we're not very good at, is identifying the things that will contribute to that outcome and to know that we're making progress on those. So I think in that, you will be able to start to think about, that assurance manager will be able to start to think about how you measure those outcomes if you are able to identify the actual things that you have to deliver, that are the steps on the way along the journey to get to the outcome.
Absolutely, exactly. That's a beautiful segue into the next slide, which is that new strategic leadership team structure.
I'm watching the time.
Oh, quick. So the head of service delivery, the deputy chief, and the head of operational resilience, they will together make sure that the services are being delivered. So John Foster, the deputy chief, will work through the 4 district group managers, Mark and his 3 colleagues, to make sure that the services are being provided, and that operational resilience head of will make sure that they have everything that they need to do that, whether it be operational training, the guidance, the policy, the procedure. That's what they'll be doing. That head of assurance will be, and we have appointed them as recently as last night, and I can now say, actually, because all of the candidates know, we are bringing in a new colleague from South Yorkshire, and he will be taking up the role of head of assurance as soon as he is available to do so. His job will be to get a model in place that enables us to do exactly what you've just been talking about, so that our staff can quickly and easily and unbureaucratically record what they're doing and measure the impact of what they're doing. It's not easy, and we're not pretending that it's easy, but we'll never achieve it if we don't start. And they're very specifically going into that role, and that is to provide us with the assurance that we're doing a good job. And also providing assurance that the services we receive from Enable and from other service providers, other suppliers, are also of a good standard and providing us with good value.
Okay, great. So we're going to hear the case studies.
The last thing I'll do just before we go into the case studies is, this was the HMI results. This is the first PAM since we got our HMI report in December. They said we were good at effectiveness at 3 of the 5 sub-diagnostics, they call them. So overall we were good, but we need to improve at prevention and how we measure and identify risk. But we were good at protection, at response, and at national response. So the public can be really assured that the services they're receiving are overall good, but there is room for improvement. We need to improve our efficiency, how well we use our resources, and how well we deal with our people, look after them and provide them with everything that they need to be able to do their jobs effectively. So that's a really helpful line in the sand for us, that we can take lots from their report, and that will form part of our improvement plan.
Okay, great.
So, Mark,
So I'll
how long have we got, by the way?
Well, you've reached your allotted time, but this is the bit that we want to hear. So
Skip through the bit we want to hear.
We've got quite a few case studies. What I'll do is I'll keep mine as brief as possible, because mine are what's been reported to me from parts of the county. Because I think what's really interesting is hearing about somebody that actually delivered on
Exactly,
these case
yeah.
studies. So, looking at the people, looking at what we did in the last 20 years, we used to go out to a fire. We put the fire out. If we were lucky, we put a smoke detector up, and then we would tidy up a little bit if we thought the person was going to struggle. And what these case studies all show is that this reacting to people, or even when we have the intelligence and we go to people, we do just so much more as a service, so much that sometimes, I just wonder what story I'm going to be told next of what we've done. So, looking at the sort of the groupings of what we deal with vulnerable persons, older people, we've had a crew go out and do a safe and well visit at an elderly gentleman's house. They've come back to the station, and it's by the fact that individuals have been talking to them, they've all picked up part of the story, and it turns out they've worked out when they've got back that the individual's one passion in life is potting his plants out and watching them grow over summer, and he couldn't do it because of his mobility issues, which had changed, which is why he was vulnerable, which is why we were there in the first place. So in their own time they went back and potted all his plants out for him, and it's that work there is the bit that we're running through all of these. It's just keep thinking, how do you measure the impact of that on one individual? That's the only thing that keeps them happy now. And
It's a bit like social prescribing, isn't it?
It's exactly that. And I only learnt that phrase about 6 weeks ago when I was at an NHS meeting.
Yeah.
And if you'd have told me 20 years ago joining the fire service I'd have been at an NHS meeting, I'd have wondered what you were on about. But that's how we've developed as a service, and that's how we're building these partnerships. We've had a crew respond to an emergency call where the resident was confused, thinking the smoke alarm was going off. It was a carbon monoxide alarm that was going off. It was not one supplied by the service, so we didn't have a battery for it. So out of their own pockets, they just went and bought some batteries, went back to the place, didn't leave the elderly person all dazed and confused, put some new batteries and left them on the shelf for them to keep doing it when it goes off. We've got quite a few stations doing coffee mornings, doing dementia awareness, dementia friendly stations. We've got lots of interactions annually, but we've also got places that weekly, that Friday mornings, coffee morning, and so on and so forth. And the group comes and makes and uses the station, and all the crews interact with them. And then going that bit and beyond, we do have a crew that went out to an incident with a gentleman that had mobility issues, an elderly gentleman. They did the Safe and Well visit. During it, they realised that unfortunately, he'd soiled himself and he'd been sat that way for quite some time. So I think years ago we would probably try to get an ambulance or a nurse or something like that. And instead the crews just helped to redress him, showed compassion, showed dignity. Didn't even tell anybody until we found out about it from another route. But it's just that going above and beyond really on a day-to-day basis. People like Brian, who's here because he's particularly good at it, he's going to tell you his case study. So the next one we move on to is people with mental health concerns. So as I've promised, I'm going to hand over to Brian. Brian's watch manager in charge of Green Watch at Scarborough. And he's got one particular case study where I think by the end of him telling it, you'll see that you won't find a lot of the actions that Brian took in his role map.
And it'll answer a few of your questions as well, and just show you how good we have been at moving on. But we attended an incident in Scarborough on one of the bridges using the specialist equipment, Gotcha and Alp.
Alp being in an aerial ladder platform.
Gotcha being rope rescue team. We'll keep it stay on that.
But we've come across this gentleman stood on the bridge for whatever reason, and we'd worked with the police and done our bit and rescuing him. And normally we'd just hand him over to the police, we'd pack up and go. But we'd made a bit of an effort to speak to the gentleman, and he was being referred to the Rainbow Centre, which is a charity run based in Scarborough. And I'd had a brief chat with him, and he had nothing, no clothes or anything. So off he went with the police to Rainbow Centre. We went to a charity shop, we got him some clothing, shoes, trainers and what have you, took them back to him, and he'd had a shower, we give him the new clothes, a further chat with him, we invited him up to the station and we fed him and stuff like that. I got to know him a bit and I thought, there's a bit of spark left in this gentleman, I think we can help him. So we got in touch with a few charities, and we got him some temporary accommodation. The Beyond Housing were brilliant. We got in touch with them, and they found him some secure accommodation within 3 days. We'd done a bit of work and got him a job, and everything, it was just we invited him back to the station, and he kept coming back for weeks, and we were feeding him, getting an update, and then he ended up bringing his kids to the station, and you could see it all unfolding. And it was just that little bit of extra work, a bit of extra time with him, and working with the other agencies and finding him, just putting him back on track really, and getting back to being back in the public. And it is a nice story, but it's not an isolated case. All the watches on Scarborough are like this. It's weekly, it's like I said to Mark, we're doing it weekly. It gets captured on the recording tool at work. All the intel gets put on CFMS any time we spend with them and things like that. So if you've got any questions, just feel free to ask. But this is where we're moving on.
There was a line dropped in there about getting him a job, as if it was a
few of them,
throwaway comment. Speak a bit more about that.
Because
How did that come
in
about?
talking to him, he told me he was a roofer, and he was in the building trade. So I just phoned up a local building yard, explained the situation, and he said, "Yeah, I'll take him on." He said, "Send him down, I'll give him a job." And then off the back of that, then it was a bit of travelling for him. So then he went and got a proper roofing job back, because he used that as a reference, because he was at a real bottom of his life, and he'd been on drugs and mental health issues for a few years. But because he'd got another job and he'd done it for a few weeks, that was a reference, and then he got back onto a roofing job where he wanted to be.
And how does that make the firefighters feel? I mean, that could be really satisfying seeing something like that.
Oh yeah.
Yeah.
It gets them going.
Yeah.
You know, and that's all the watches are the same. You know, it all gets captured on the district action planner, CFMIS. So we've got a good gathering of intel of what we've been doing, and time and motion and stuff like that. So
I bet the HMRC didn't see that, did they?
No, and this is one of the points, isn't it? We record that. What we're not able to do is now, at the moment, what we will become able to is start to be able to measure the causal effect on his and his family's performance, but also all the other people that he interacts with. Because he is now far less likely to create demand for the fire service, for the police, for the health services, for voluntary services, because he's got himself back on his feet. So actually that intervention, which must have taken a reasonable amount of time and effort and commitment, but it's a huge impact in terms of the lowering of the demand under all of those agencies. And there's just the human sense of it. There's somebody whose life is far better now than it was previously, to the point that he was on the wrong side of the parapet of a bridge.
yeah.
Well, can you say thank you to you and to your crew for doing that? So thank you very much.
I think just before I move on to the next one, I just want to point out the other things that he said, which was that we fed him, the service did, the watch did out of their own pockets, and you know, we found him a house, and then we get him another house. You know, you're right, Foster, it's the amount of hours it takes, and all you'll see currently in the recording is some hours, but the impact is significant. So.
And we need to be able to show that.
And the food was all right then?
What was really interesting was that it wasn't just one watch that fed him. One watch told the other watches to feed him as well. And they fed him. So, yeah, they all pulled together.
It's all healthy food at fire stations.
There is one watch that I will say does a 9 kilogram meal, but we're not. No, it's not Brian's watch. No. So people living in poverty. So we've had a crew from Akersham attend an incident where an elderly lady, she stated she'd had a fire in the flat. When the crew actually arrived, there was no fire. And they got talking to her, they did a safe and well visit, and she said that she just felt a bit isolated, and when they looked into it, there was no heating in the flat, there was no electricity in the flat, there was no gas in the flat, there was no working landline in the flat, and basically she hadn't eaten a warm meal for months. So what they actually did was they put all referral processes in. So they put a referral into social services, they put a referral into the housing provider, and put a referral into safeguarding, so that the individuals then getting that support that they need. But most importantly, they went and got a flask of hot tea and something to eat as well. I suppose when you're trying to measure the impact and outcome of that, the only outcome that I know of with that particular one is that we're temporarily rehomed and we're being provided with shelter, warmth, electricity, light, telephone and warm meals. So, but it's quite difficult to record that in our current system. During a routine operation ambulance, crew from Whitby, now operation ambulance is where the safety of provides intelligence and multi-agency go out and they do work in the community. So crew from Whitby went out, they found an elderly gentleman that they knew there was vulnerability in the area, but the neighbours said that he'd been walking around with no shoes on, found he had no food, and he hadn't eaten for quite some significant time. So they didn't just do the safe and well, they then contacted another agency, I believe it might have been Red Cross, and got the gentleman some food parcels, and then you get the referrals in and then the person's life is changed back around again. So lonely and socially isolated people. So crew at Richmond went out to a lady who'd burnt her food. She was awfully embarrassed that she'd had a small fire where she'd burnt food. She identified as being really lonely. So what they did was, while they're there, they didn't just do the safe and well visit, they cooked the dinner properly for her. Which I don't think we provided that training yet, but so, and then what they did is they referred her on to Age UK. So, and then they went back after a week to make sure she's all right, and she's really happy. And says, I've got the quote here, she can't believe how many people are visiting and calling, and how there's so many wonderful people out there. So, people in immediate need. Crew from Ripon attended a property where there was a tumble dryer on fire. Turns out the family, a woman and 3 young children, had been rehoused to this place from a women's refuge. They'd only been there 2 days. So they not only did just the safe and well visit, helped clean the house up a little bit, fit the smoke detector we used to do years ago, but then they went to the local charity shop because they didn't have any clothes effectively, and everything was black bright. So they went to the local charity shop, got some clothes. One of the crew contacted home, got his own house to provide some of the clothes to the incident, so that they had clothes to wear for the family. And then they took them back to the station so that they could use the telephone lines, use the showers to get cleaned up, and get themselves relocated back out to the family members, which we're going to be able to contact. We've had a car fire at Whitby where the crew usually finishes at 6 o'clock and then becomes on call. After 6 o'clock they get a car fire, the people in the car get out of the car, the crew go along, put the fire out, and then the insurance company says, we'll provide you transport to the nearest train station, which stopped running 3 hours earlier. So they were stranded, and they were stranded at, I think, about 80 miles from home. So they just brought them to the station in their own time, sat with them, had cups of tea, a chat, and then eventually the family were able to send cars down to pick them up, none of which we paid for. We've had a crew from Scarborough transporting families home from an incident at the hospital where people had gone to A&E for treatment. Obviously, they'd been treated. We had an ongoing incident outside of the A&E department, and the people were trapped to not be able to get to the cars because of the cordon that I'd put in personally. So what we did was, after a couple of hours, we identified the ones that couldn't get home because they hadn't brought money with them. We were going to be stuck there for quite some considerable time. So we sent the fire engine to go pick a van up, and we became the local taxi firm and dropped them off. Young people, we've had staff do a special open day, completed 3 pigs challenge for a local person that's got leukemia, a young boy. We've got a station that have a gentleman come onto it every couple of weeks that has learning difficulties, and he likes to come and wash the fire appliance with them, which is good for the firefighters because they don't like washing it, but they have to look in and help. And then they all go to the station for a chat. Brian's got one case study about a young person.
Yeah, similar to the previous one, but the crews had attended a young girl. She was only 12 and she was trying to jump off a particular building. And on this occasion we attended, and we did a bit of interaction work with her, and we really got to speak to her. And it was the life course. We had one coming up, and I got talking to her, and I managed to talk her onto doing this life course, and she was really keen for it. So it gave her. But when I spoke to her for about an hour on this road, you know, her upbringing was terrible, and I could see what was going on. So it was like she needed someone to lean on, and I thought, right, we'll get her on a life course. We had cadets up and coming, so we said, right, we're going to put you on this life course, see how you get on. And we spoke to her carers and stuff, and we did quite a bit of work with her, and she did a week's on the life course, and she was brilliant. She got top girl for it, and then she went into the cadets, and we in works time we still go and see her now and again. And I said, you know, when you get uniform, we'll have a picture and stuff with you in front of the fire engine, and we're proud of her. And we've never had any more work with her, and I think again it just shows where we've shifted to, because it's all captured, and the referrals, you know, we come back and there's particular agencies on the referral boxes, and they get sent, and all the agencies pull together, and the CSOs, they get involved, and it's just another good case study.
Fantastic. Well, I've met some of the case studies at the life courses. They're always quite vocal, some of them, and they're, you know, it's good. It's really good, but I think the thing that I've really observed is the way that the firefighters interact with the young people, and they get a connection with them,
Yeah.
which certainly I couldn't do.
They're brilliant for the for them kind of, for them kids. It is a lifeline.
Yeah.
And they get a week on the fire station, and if they want to come back and we can work.
They tried to get me in the Alp the last time I went, not the new one.
No, 50% higher.
Right. Well done.
I think there's one more, isn't there?
So one more, right?
Yeah.
Because if we do,
we're going to be quick.
Yeah.
Really quickly, on a lighter note, we even helped to save Santa Claus and helped to save Christmas. So Harrogate Station, they cooked Christmas lunch for 45 people, 12 of them homeless, the rest were lonely, dementia or anxiety, all off their own bat, really good. A crew saved the day when hundreds of young children were on the Polar Express steam train and it ran out of water. So we had to fill it up for it to actually get to see Santa. And lastly, just on about saving Christmas, Brian's got one more case study.
And again, these are just little examples. We are, all the crews are working weekly like this, and they're all really good. But we've got 250 selection boxes donated to us, and some cash which we give to a local charity to help these children who are they're all from deprived areas. I mean, some of these kids, they turn up to this nursery without even wearing shoes because they've got nothing. And I've seen them going home and they get given the dinner in a plastic bag and they say, that's your tea for tonight. And they're only toddlers, like 3-year-olds, and it really touched me. So like off the back of that now, what we've got in place is we're going to do a vegetable garden with them at this nursery and try and educate the kids about growing food, and we're going to make some work with them and hopefully over the next few months see a garden growing and the kids getting outside, and we're getting into these deprived properties like the drugs. We're getting in there because we'll get to know the parents and do some work with them, and hopefully we're just going to educate them, all the kids on food, healthy eating, the parents on safety, and it's all moving in the right direction.
Oh, that's great.
So that's it. Thank you very much.
There's one slide left, and this sums the whole thing up. It'll be quick. So my favourite parable is of the little girl on the beach covered in starfish. And all the starfish, thousands of them, have been washed up on the beach. The tide's gone out and they're going to bake in the sun. And there's a little girl walking along the beach, picking up starfish and gently throwing them back in the water. And somebody watches and then goes across and says, what are you wasting your time for? You're not making it. There's thousands of these starfish. You're not going to make any difference. And she looks and then ponders and leans down, picks up a starfish, gently throws it in the sea and says, I made a difference to that one. So we maybe can't save everybody, but we can save some. And the way that we've extended this is through the priorities that you have set us, the outcomes that we're to get. And it's about finding which starfish can't help themselves. Because if we imagine that some of the starfish can flip themselves back into the sea, then we don't need to help those ones. If we target and tailor our work properly, work really closely in partnership with the public community leaders and with the public sector front lines, then we can identify which starfish are the drugs, the blogs, Mr. Frog and Trog Industries, and we can go direct to them, pick them up and place them back in the sea and leave the others largely to help themselves. And that's how we sum it all up. Hopefully today you've seen that there is a strategic approach to this. There's a change within the service, a change of emphasis and a change of around empowerment and responsibility. There's a change that Mark can then take to Brian and the rest of his teams, say this is what you need to go and do. Find the most vulnerable, work with other people in partnership and make sure that they're as safe as we can possibly leave them.
Great, thank you very much. Thank you. Thank you very much.
Sorry we ran over a lot.
How do we follow that?
Well, I'm
we haven't got a Mr. Frog, but we've got a Mr. Harder, who is the head of safeguarding. I'm just conscious of the time. He's going to take us straight into the
we will gain time at the end.
All right,
of it,
okay.
so don't worry. Yeah,
Right.
yeah.
Because there's a lot of good news within here.
Okay.
So, obviously here to talk about Cane for the Vulnerable, which is a brief that we've been given to provide information on what North Yorkshire Police have been doing in relation to the subject of the care plan. For the first two slides, it just sets out what the objectives were. So I've just included those to that for people that will be reviewing this, will be able to know what they are. And obviously they're very closely aligned to those at the Fire Rescue Service of Brettingham. So I don't propose to go through those,
No,
if that's okay
yeah,
with
yeah,
yourself.
yeah, yeah,
Okay.
great.
In terms of strengths, what's working well, I think there's a lot that's been working well within North Yorkshire Police and with our partners. And they're only just some of the bullet points around those, and we've discussed those with Tom previously. But just to go through some of those, if I can, please. I think it's really important to recognise that since CARE, mnemonic, the Policing Crime Plan was released, it has really become embedded across North Yorkshire Police. It's recognised not only internally but also externally. And the fact that it's been embedded is understood, and that police officers, police staff, both on the front line and within the support services that we have, are able to identify vulnerability, and that it's a priority within the organisation. I think it's a credit to how that's been embedded across the organisation. And that's recognised by the HMIC FOS when they've come in and completed the inspections over the last couple of years in relation to that with that. In terms of how we've been able to do that, I think it's obviously we need to understand it, but a lot of the areas of vulnerability that we deal with on a day-to-day basis, we can't just deal with it by ourselves. We need to deal with those areas with our partner agencies, whether or not that's adult social care, children's social care, fire and rescue service, and all the other sectors across health. They are quite clearly involved with us, and I think it's recognised across North Yorkshire and the City of York that we do have strong and effective partnerships with those other agencies to make sure that we can deliver in support of those vulnerable people and victims across North Yorkshire. And a good example of that is around the modern slavery and human trafficking. It's not a statutory board that we need to resource, but we've created two. One at an operational level, where we work with our public sector partners, our third sector partners in terms of at an operational level. But we've also got a strategic group in relation to that to make sure that we've got the oversight and that we're working for all the agencies' objectives to make sure that those people that are victims of modern slavery and human trafficking are being supported and identified. And I think that's a really good example of how partner agencies have gone that extra step to do that for those people.
So Alan, can I just ask, because there has been some criticism with wider partners, not necessarily in North Yorkshire though, about sort of understanding of human trafficking and modern day slavery, and whether or not local authorities, for example, have got the right knowledge to be able to do what they need to do, because they are one of the official first responders, aren't they, for that. Do you feel confident that it not just in the relationships but in the knowledge base of partners as well?
Certainly I do. I think in terms of the want for knowledge and their willingness to learn is recognised in a number of areas. A, they're willing to come to the table and discuss it, actually, so it's on their agenda. Secondly, when we have the multi-agency safeguarding conference this year, or the middle of last year, all partners without exception asked for modern slavery to be on the agenda. So that was around county lines, because that would fall into that. And in addition to people being trafficked, so that would fall into it.
Okay, so I just want to push on that a little bit, because the county lines is I know victims can be referred into the NRM.
Yes.
And and we've had quite a lot of child victims that have been referred into the NRM. But that is one very specific element of modern day slavery. Still very low numbers of prosecutions using the Modern Day Slavery Act. So that will be one, I don't know if any in North Yorkshire?
We've taken, I think it's 40 CPS in relation to that for
Right.
conservation. So,
And what have the CPS done with them then?
and I think it's actually in relation in terms of what are the offences that are being prosecuted for. So
Under the
sometimes-
Modern Day Slavery Act?
Not under the Modern Day
No, well
Slavery Act,
that's the point that I'm making.
but I think
Because
it's-
the penalties under the Modern Day Slavery Act are clearly much more stringent around other channels.
Definitely. I think in terms of the work that's being completed, obviously CPS is the prosecuting body, as you know that, for the public in relation to that. But actually they will look at the offences that they can charge and that they will prosecute for. So those offences that have been taken to CPS we've certainly had more than 4 charges in relation to offenders, because actually it's that disruption.
But what for what charges though?
For example, the Fire and Rescue Service are prosecuted in relation to for some offences around over occupancies. The trading standards are prosecuted in terms of food standards, and actually how do you disrupt these groups? So it's that multi-agency approach to discuss, to disrupt organised crime groups and those people that are involved in modern slavery. So it's not just the single approach on modern slavery legislation.
No, I get that. I'm across that. Yeah. So, but I suppose the question is, so we've got large numbers of young people going referred into the NRM. I think the last statistics I looked, there'd only been 9 adults referred into the NRM, which isn't very many. When I went and visited some of the service providers who are supposed to be providing a service for victims, supporting victims here in North Yorkshire, they hadn't even been in North Yorkshire, even though in theory they were contracted nationally to provide services into it. So I'm trying to sort of understand where all of that is at the moment. Whether we've got the new Women's Centre, for example, in York, which might become a bit of a base for some of those services. What opportunities are there to try and sort of.
So I think going back to your question of how well do our partner agencies understand it, they've certainly expressed their views that they want to develop. They have developed over the last 2 years in relation to that. In terms of the identification of victims, they are putting referrals in for that from the NRM.
Are they mostly children though? Are they?
A lot of them are children,
right.
But that's probably reflective of the numbers of people that are being identified as victims of modern slavery and human trafficking are British children.
Yeah, but they're swamping the NRM, and it's causing a whole range of issues.
It is, and so we're having conversations. Even today, one of our inspectors has gone across to speak to the competent authority about that, because of the issues around those people that are coming into the criminal justice system as offenders, but are also subject to national referral mechanisms as well. So it is an issue, it is being looked at, and that's something that we were trying to resolve.
I mean, it's not just a North Yorkshire issue.
It's national.
Yeah.
And I think because of the working relationships that we've got with our partners, we're able to have those conversations with them openly.
Yeah. And I think that's key around developing the partnership, that understanding that you've talked about both locally and nationally, and having those structures. I think that we are building. There's definitely more that is needed with this, in terms of having, which is interesting about the outcomes in terms of the use of the Modern Slavery Act. It's about understanding those measures that you spoke about previously, still being able to tackle it maybe in different ways, but certainly more to do. But I do think we have got partnerships in the development area around it. It's just really, putting that momentum. So the Independent Anti-Slavery Commissioner has a whole section around enforcement in her strategy. There is a real concern from Sarah and, for example, from Simon Bailey, that forces are feeling that legislation means the investigations are too complex, they last too long, they're too resource intensive, all of those sorts of issues, and whether or not that is a consequence of the legislation, if you like, or is reform needed, or are we just not doing it in?
One of the bits of feedback from the County Lines Coordination Centre, if I'm right, is that there are opportunities to prosecute on some of those lines that aren't taken
precisely
because of some things like around is there capacity in North Yorkshire Police to be able to take those complex long-term investigations forward.
So certainly Sarah Thornton's view is that they shouldn't necessarily be long and complex.
Well, yeah.
I mean, I don't know any of the cases, but
no, and to give you some reassurance if I can, we do meet with CPS, not just on a force level but at a regional level, to discuss some of the challenges around getting those prosecutions, securing those prosecutions, because actually that's what we need to do, work with CPS as one of our partners to present that evidence to them so they can do that. And that's it, one of the senior managers of the CPS to do that. that's what we're going to work through until those.
So Alan, but if there are issues there, I chair the local criminal justice partnership. We can escalate things through the LCJP.
I totally agree.
Yeah.
I totally agree. And if there was the necessity for us to do that, we would do that. We'd work with Leanne. We'd come to yourself to do that. But actually, in terms of that work, to identify around investigations, what we need to achieve with an investigation, that is within the structures that we've got to be able to do.
And just the update from Home Office at our Serious Organised Crime Partnership Board yesterday was more and more use of students. So there's not trafficking because they're not moving around quite so much, and if they do move around, they're much less traceable because no one really misses them quite the same way. But they are more fixed in location rather than being sent around the country. So there's because criminals are getting wise to some of the legislation that's being used to prosecute them for long periods of time. So they're afraid of the trafficking legislation, I think.
So they're finding alternative means.
Correct.
Other areas
And
of
older as well.
So other areas of strength as to what's working well is around the commissioning support for domestic abuse victims through the JCG, the Joint Commissioning Group. In terms of some of the work that we've done through your office is being able to provide that support through IDAS and some of the other support services that are available for domestic abuse. And I know domestic abuse is an area that we've been doing a lot of work. It's still an area that we want to do a lot of work, and that will come on into some of the later slides. But the work that we've done around supporting those victims is around to the prevention and early intervention work, around the use of domestic violence prevention orders, which have seen a significant increase across the county. We're not just obtaining the orders, it's also been about policing those orders and identifying the breaches and taking those offenders to court.
How many times have you done that? When there's been a breach, taken somebody to court?
I don't have the exact number in front of me.
Because it'd be really interesting to get some of the stats behind some of this.
But if memory serves me right, it's around about 40%, which is quite high in terms of doing that.
From actually in the role as a super, as having to authorise the DVPOs, DVPMs, there's quite a lot you would see further down the line after a year or so of being the repeat applications and the fact that they've breached before and been before a court, but then another application was in front of you. So that I think it was becoming.
I mean, I know the numbers going through the force have increased quite dramatically,
Yeah.
but it would be really interesting to be able to sort of see our numbers versus other numbers, look at the data around breaches, all of that sort of, so we can get a bit of hard fact to this.
And we have done that. I think I've reported on that. I've joined the PAM for domestic abuse.
Yeah.
So that will be on one of those previous presentations that we've got. I can find it. But I think it's between about 30 and 40% in terms of the number of breaches that we do have. And actually, we need to police those, but we can't do that. We shouldn't be doing that by ourselves. We should be doing that part of agencies. Those other agencies that are going across the threshold of that into that family to make sure that they get the support. So victims can get their respite, and then they get in that space where they can make an informed decision about what they want to do in terms of prosecution, so we can support them and also the children. We're also, what's working really well is Clare's Law, which is about domestic abuse, right to know, right to ask.
Because take-up of Clare's Law has been low across the country.
In terms of North Yorkshire, it's high.
Right.
Because at my view, and we'll push that throughout the side, so the domestic abuse teams are, if we're aware that a person presents a risk to somebody that they're living with, I think it's right that we inform that person.
Right.
It goes through the right process, and we don't just disclose everything. It's considered, it's proportionate, it's necessary. But actually, that's so that those people in those relationships can make an informed decision about their own safety.
So how does that link with perpetrator programmes then?
So, because Clare's Law is just around informing the victim.
I know, but if you've got intelligence on the perpetrator, we have the matter.
Yes.
We have
So what we're trying to explain, what comes to you, is that we've got a number of prevention and early intervention models. So DVPO is one, Clare's Law is another, but we've also got the MARAC and the MATAC side of it. So the MATAC will be identifying those offenders that are high risk and serial perpetrators. So we'll be approaching and ask whether or not they want to take part in domestic abuse perpetrator programs to reduce the risk and then re-offending. So obviously we've had that now in force for a year in March. That team's recently expanded about some of the analysts and intelligence research officers that are working in there, and we should see an uptake.
Only if I get my precept through.
Yeah.
Because that's where we want to spend some of the money.
Yeah, and I think, you know, where we've seen the evaluation is
Yeah.
really, really positive
Yeah.
here about reducing the offending, and that is absolutely key to that. And so knowing what works, we need to be doing more of that.
Yeah, we are making arrangements, but we've got an academic who'll be coming up to do some work around the eight steps of around escalation to domestic homicides, you know, and the key factor in those domestic homicides being coercive control as opposed to physical violence, and there's now quite a large evidence base around all of that. So, you know, we have still got, I think, a ways to go around coercive control. I mean, you're still all calling it domestic violence instead of domestic abuse, which I think is a terminology thing, but it's important. So I just think there is a way to go with some of that.
So in terms of answering your question, how does that link in? It's that prevention, early intervention model of how they all interlink together.
So do you have a system, sorry Alan, do you have a system then? So you've got, I don't know, on a database somewhere, a list of high risk perpetrators. If you find out that somebody is going into a relationship with that high risk perpetrator, do you tell that individual?
That's what we would do. So, for example, if we know that the relationship is broken down, we're still concerned about who the perpetrator has gone on to be with.
Yeah.
So, in terms of reviewing where that person is and what they're doing, we will an intelligence requirement is who they're now in a relationship with.
Right.
So we will make that considered disclosure to that person.
Right.
Because actually, if we know that, well, I think that's right.
Is that common? Do all forces do that? I don't think
all
they
forces
do
it
they?
as proactively as we do.
No.
And I think that's why I think it's working well.
Yeah.
It does create demand, because actually through the work that we're doing, it's a demand, but it's actually, if that stops somebody becoming a victim, I think it's right and proper that we do that across it.
I think there's reasons why we focused on that. Our previous homicide prevention strategy from 2010-2011 identified that although we have low numbers of homicides, we have twice the number of domestic homicides percentage-wise than nationally, so that clearly we can focus that attention on highlighting the risk to victims. So it just is seamless in terms of how that works.
That's good.
And an area that we have seen some development is the use of body-worn video. That is being used when police officers are attending scenes. But we've been able to use that proactively, not just in terms of some prosecutions, but also with partner agencies for strategy meetings, for example. So if police officers have been into a house where it's signs of neglect from the children, we've been able to use that with social workers in strategy meetings so that they can see what the house was actually like at the time and explain one of the reasons that we've done what we've done. Just looking at some of the other areas that we've talked about, just wanted to talk about street triage in terms of in the control room from the morning till midnight. They are sat in the control room working alongside our call takers and assessing those incidents which are being flagged as having mental health concerns. That's really important to be able to reduce the vulnerability of the person that we might be going out to see. They've got access to those records and they actually turn out and go to those incidents as well, which is a real step forward in terms of protecting those vulnerable people that we come across. And some of those vulnerable people are female, whether or not that's the victims of domestic abuse, drug and alcohol, mental health. So a scheme that was introduced into the force 18 months, 2 years ago was the Women's Diversion Scheme. That's getting an uptake. It's certainly improved in the last 12 months from where we were. We're now getting between 12 and 15 females going into that project each month. The key part about that is the reoffending rates for those females that are going into it is up to 80% aren't reoffending.
So Alan, why the step change? Because before it was not working, so it clearly is working now. What's the difference?
It's around education, promotion and pushing it. So I think the first time it was released, it was briefed. I think because the take-up wasn't good, we've done it again, and actually we've done it again. And I think the more people get to hear about it, and then they see the successes about it internally, positive, through the case progression managers, but also externally. So, for example, one of the things that we want to do is make sure those solicitors that were attending police stations for interviews were aware of it, because actually it's an option for their client. If they understand what it is, they're able to support the client in the best way. So we'll just take a different approach in terms of how we publicised it internally, got the message across. But I think if we've not, if 80% of those ladies that are going into that are not reoffending, that's tackling the really important issues. So whether or not that's getting them into drug and alcohol programs, mental health support, is really positive.
Just there's some lessons there maybe about sobriety tags. So
Yeah.
we were part of that with Lincolnshire and Humberside
Yes.
and had the lowest uptake. But the reason the link is that the majority of those offenders were domestic abuse offenders, I think. And so one of the reports suggests it was partly a lack or a challenges in communication with partners around sort of explaining the benefits of taking it up.
Particularly solicitors.
Yeah, that's why I mentioned it.
But also the magistrates didn't understand the sobriety tagging scheme either.
No, we felt it was.
And a lot of
Yeah.
defence lawyers didn't actually want it. They preferred
exactly,
punishment rather
yeah.
than this attack, which
Yeah.
makes sense.
And it's not giving up, which I think just reflects the forces and staff's views on helping people. It's the right thing to do, and that's where we've got to. So there's been a big investment in relation to the online team, the detectives supported by police staff, around online offending. Those people are accessing indecent images of children, which is challenging in its basic form. As a team, they're receiving about 28 referrals a month. They're people that are of concern. And following the work that they're doing, that's producing between 2 and 3 warrants, proactive warrants for policing into people's homes to try and recover the evidence in relation to that.
Can I have a question about that? I know it was something the previous ACC was pushing through. There was going to progression towards a mobile digital forensics unit or something.
So certainly when the officers go to the scene, they can triage the devices. So the devices are plugged in, that checks the memory, what's in it, and then the benefit of that is they're able to see the items of equipment that show positive indicators. So instead of seeing 10 laptops, which they will then create demand within the digital forensic unit, we just might seize 2, and then we can have a targeted approach around that. So in terms of that. But of those warrants that they're doing, probably about 10% of those people get access to children, which is a real concern. But we're identifying those, the work that we do with partner agencies, about children's social care, DWP, etc., to identify those high-risk cases. That does have an impact. Yes, we're having some good successes in relation to reducing vulnerability by targeting those perpetrators. But it does see an increase about registered sex offenders, and I think it was probably about a year ago we had a presentation about the offender management unit and the increase of that, and we've seen that over the last, that's a national matter that we've spoken about previously before. Also, some of the proactive work that we've done is around sex workers. I do a lot of research to identify local sex workers that live in North Yorkshire, and also some of the migrant sex workers as well, and very different reasons for why they're working. Some, in terms of the migrant sex workers, some of those may be victims of modern slavery and human trafficking, and that's why we go proactively to go and see them. This is not about enforcement, because actually working as a sex worker is not against the law, it's around education. And for those local sex workers that we've visited, that's around getting people to access drug and alcohol provision, sexual health clinics, mental health support teams if they need to do that. And we've had some really good successes that people have been engaging with us in order to do that. And because we're breaking down those barriers between sex workers and policing, it's increasing the intelligence that's going through as well, so we can target people. And just to increase people's awareness around vulnerability and safeguarding across the organisation, we introduced safeguarding champions. This is in effect for the sergeants to come into domestic abuse teams, the VAT, the MASH, to develop their understanding and awareness around vulnerability, and then they can take that back to their teams and in terms of supervision, and that's what we've been doing in relation to that. So there's some of the strengths that we've had, but looking at some of the challenges and what we're trying to resolve, you'll be fully aware around the issues of domestic abuse in rurality. and the report that was completed in relation to that. There is a 10 points that came out in relation to that, which there's now a working group that has been progressed, and we're working to try and address those actions that come from that.
So can I just, so there's a lady, a woman who has a blog that notes every single homicide of a woman by a man. It's interesting looking at some of those. I'm just interested, Mike, on the comment that you made about domestic homicides and our proportionate numbers. Yeah. So researchers have gone through the history of some of those, all of those homicides, and looked at the circumstances. And I just wonder whether we've done the same. I know we have to have formal domestic homicide reviews, but I do wonder whether anybody's looked at them through the lens of rurality and some of the findings of the research.
My initial view would be no, that isn't a piece of work that we would have done.
I know we wouldn't.
I mean, domestic homicides have come down certainly into force. When we did the review in 2011 from a force point of view, but generally the homicides have come down. But it's not something that was specifically looked at around the rurality side of it. Yes, we have the domestic homicide reviews, but if we haven't had those domestic homicides, it's a case of, well, is there anything to review? But there may be a point to look at the rurality element of it.
It was something we tried to do when we did the
national
work, and the Home Office were keen to support that. We just didn't have the capacity at the time.
It's just interesting. It's just interesting. So the academic is Dr. Jane Monckton Smith, who's been looking at this. Did you see? I don't know if you've seen her presentation.
I've not seen a presentation. I'm aware of the 8 points that she talks about.
Yeah.
The 8 steps to homicide. Because that featured within our ops boards about 3 months ago.
Well, we're going to get her to come to we're going to do a bit of a planning of org strategy planning day. We're going to get her to come and talk through her research because it is really, really interesting. But I don't think anybody's actually looked at, and there is a list of all of these domestic homicides.
Didn't think they had
Yeah.
anywhere nationally when I asked them the question.
I think numbers-wise, it needs to be looked at from either a regional
But
or a
precisely,
national,
exactly.
a bigger point
Yeah.
of view, because then you can attach whether
Yeah.
you might say North Yorkshire, well, the rural communities are more affluent rural communities, and maybe domestic homicides might be connected to sort of the maybe poverty side of things. So we need to look at it from that as well, not just the rurality side.
Yeah, yeah. Okay. Well, let's. I mean, I just think it's worth. We'll take it away again to have another look at it, because I hadn't realised that there was this list where you could just access all of the names, and it's interesting. I mean, the numbers certainly aren't from that list, don't look as if they're going down. I don't think they are.
Just had a number in North Yorkshire.
Yeah.
This is from a North Yorkshire. You know, the rurality one of the last ones we had was probably the post office job in near Richmond.
Yeah.
Which didn't look like a domestic homicide, but was a domestic homicide.
Well, so the Jane Monckton Smith doesn't just look at domestic homicide; she looks at all murders of women by men, and actually the pattern that she's identified is common pretty much across every homicide, not just domestic. So so some of them are stalking cases, which are not necessarily domestic homicides, although there's often relationships obviously involved in it. So it's really worth spending a bit of time looking at it.
Yeah, we can look at it, because we looked at when we did the homicide prevention strategy. Houses of multiple occupancy were another concern, and we certainly had quite a few over the coast of those types of. They were a high risk area where it's much more likely to have a homicide in those locations.
Okay, all right. So it's not just likelihood, though; it's the nature of it, isn't it? So okay. Sorry, we digressed.
No, it's okay. So obviously, domestic abuse rural area is an area that we're looking at. With not just by ourselves, but with partners as well, because we need to make sure that those hard-to-reach victims in those rural areas have got the support, the confidence to come forward, so that we can support them as we move forward. There are, and you've touched on it, Commissioner, in terms of the coercive and controlling behaviour, in terms of understanding that, and I think that's very closely linked to the identification of stalking harassment offences.
So have we had any SPOs yet?
No, there's only been one nationally.
Sussex.
Sussex, that was on the day that the legislation came out
Well,
on the
I
20th.
wonder why it was Sussex.
That's rhetorical, isn't it?
No.
I think the
No, it was.
oh, sorry.
Yeah, sorry.
Okay.
Yeah.
And
I
so
think they
no,
had
we
a point
haven't.
to prove.
No, we haven't. But actually, since that's alleged, it's gone live. We've had internal communications about it. We've had quite a lot of interest, which is really good.
Good.
And so it's really positive about the number of people who've been asking questions, raising cases for either my consideration, being legal, or
Right.
a civils officer, civil orders officer in the offender management unit about, will this meet the threshold, will that? So I think that interest around it is really positive, which is good, and that's what we want to do. But I think in terms of the actual challenges around stalking is understanding it, and we're certainly better than we were, and the number of crimes that we were recording for stalking and harassment, stalking, it has seen an increase.
Let's just disaggregate stalking from harassment
They are
because
different
they are
offences.
different.
Very different.
And when you look at the numbers here, you see big increases in harassment and not such big increases in stalking. And it does beg some questions.
It
the
does,
numbers.
and we've already done some work around that
Right.
in terms of stalking offences, harassment offences, and also malicious communication offences, and that featured a fortnight ago now at Ops Board. As a result of that, we've got some actions that are being worked through so that we can address that, because actually it's an understanding of what people are doing to move forward.
Yeah, because I worry that people get confused between stalking and harassment.
They've always been put together. and
Well,
actually
they shouldn't have
They
been.
should be
Yeah.
very separate
Yeah.
motivators behind
Yeah.
it. And I think it's just unfortunate they have been historically, obviously, very much so.
A factual question, because I don't know the answer. Is coercion control limited to within a relationship, or can you have coercion control after a breakup, for example?
Because it's domestic abuse is where there's been that relationship,
But it doesn't have to be ongoing.
so it doesn't have to be ongoing. So in the same way of a domestic homicide, they don't still have to be in a relationship. It has been or currently are.
And then secondly, you might not necessarily know off the top of your head, how many charges or prosecutions we have for coercion and control?
I don't have those numbers right in front of me.
So I can ask a question as well. I know it's, does the coercion and control have to be between two people who have been in a relationship together, or could it be between a son and a parent, or some other relationship?
To be together, it's that together side of things.
Is that,
I think it's,
that sounds
I
classic.
it's like domestic abuse. It's a familial relationship rather
Yeah.
than
And at a certain age.
Oh yes, that's
I think it
I
can
was
be.
thinking.
Yeah, so I happened to be reading the new domestic abuse bill yesterday, and the definition is clear in there. It doesn't have to be a partner relationship; it's a familial
Yeah, it
relationship.
can be family wise, yeah.
Yeah,
But
yeah.
not like from a separate, from the son from one to the,
Yeah.
Yeah.
the mother in the other relationship and those, yeah.
Yeah.
It's just because it's something that I think fire crews have a potential, or our community safety officers have a potential to come across people who are victims of abuse and coercion and control, and the circumstances can be very varied. I remember in a previous service that I worked in, there was work done around helping fire crews identify the signs of abuse and fraud and things like that, and I just wonder if there's something, if it hasn't already been done already, Mark, Brian, that we could be looking at in that.
So we do have a programme in place, don't we, with young people, and there can be parents who are being abused in those
Yeah.
types of circumstances as opposed to, partners,
Yes.
and we do have that in place.
So in answer to your question, I think there is good work that we can do.
Yeah, I think
And I'll speak to
sort of
Mark
hear
afterwards
it.
in terms of how we can expand that with our domestic abuse officers and teams across the county. And your team's more than happy with that.
Yeah, so often it's just about identifying the signs, knowing the questions to ask if it's appropriate, and then knowing where to refer to, where to come to, just share those safeguarding concerns.
So so how stretched is your team around domestic abuse at the minute?
They're working extremely hard. I think in terms of the number of domestic abuse incidents that we have on a monthly basis, it's about 800 incidents a month at the moment. compared with 3 years ago where it was about 200. So that's a significant increase in terms of those reports that have been coming in. Some of that increase is around how we looked at our crime recording, around crime data integrity. So there are some incidents where we will take a report and it will be a crime, but because of the nature of the crime and some of the incidents that are taking place, we might create 2 or 3 other crimes, all of which need to be investigated. But in answer to your direct question around what is the demand on our domestic abuse teams, our domestic abuse teams are obviously responding to victims at all levels in terms of the reports that are coming in and being triaged. But they're also doing that prevention and early intervention work around support to MARAC meetings, Clare's laws, disclosures, and that is building. And I think it will continue to increase for some time.
I mean, I've got a particular reason, I suppose, is that, again, with the precept decision on the horizon, I have had some feedback that the team is really needs some additional resource.
They are working extremely hard, and it's a real challenge been there for them.
And we are investing. So just to service and manage the DVPRs, we're investing in 3 additional, or 1 permanent member of staff and 2 additional, just to do with this. But I think this is key for our operating model, about where we release capacity into these areas. I think it's absolutely fundamental, making sure we've got the right service, Commission 7 provision around it. But in terms of that policing resource, we need to have more investment.
So it goes into the discussion that we had at EB this morning, Mike, which is you know, we also, I mean, it's the same with the RASO outcomes as well, isn't it? If you've got the effective support in place for victims, that is a significant contributor to criminal justice outcomes. And I know you're having really good conversations with the commissioning team around some of the support that you might be given, but I think you know, we need an open and transparent conversation around some of the challenges that are being faced, so that we can support you and put those services in place in the way that is you know, would make a difference for people, for victims, and also might better deal with the perpetrators.
Yeah, well, we can't. I mean, the domestic abuse report is 43% up, roughly, I think, year on year. What we wouldn't want when we go back to domestic homicides, and if you have a domestic homicide review, is if a gap is found in terms of the number of potential increase in victims, and if we don't provide enough resource to it. So clearly, yes, if it's going to go in that direction, we do need to put more resource into it.
So we know in rural areas that there are victims out there that are not receiving a service at the moment. If we put more resources in to encourage them to come forward, are you in a position to be able to deal with that demand properly?
I think there will be gaps.
Yeah.
There are gaps, and actually,
Yeah.
and that's why we need to prioritise the domestic abuse victims about A, high risk, the medium risk and the standard risk, and that's what we need to do at the moment. And also understand what is that risk that's directly affecting them.
But Alan, so that's a rowback on the service that we've provided in North Yorkshire, because we haven't just focused on high risk victims in North Yorkshire. We've had a more broader service to that. And if you're saying to me now that the team is sufficiently stretched to actually having to be focused just on those high risk victims, that's telling me that there's something that needs to be dealt with. Not only that, but we know domestic abuse is in the control strategy, and it's in the control strategy for a reason, isn't it?
Yeah, there's another issue there, is that what we've so Polly's doing a review of some of this at the moment. We're finding that some standard cases are actually standard cases which have been standard cases several times previously,
Right.
and should they therefore be being dealt with actually as a medium risk case or even a high risk case. So there's already potentially a risk there that some people who have been being dealt with for quite a while are actually being pushed down and kept at a standard level when they should be.
And it's understanding where they are on those 8 stages as well, isn't it?
It is, and I don't think it's a deliberate pushing down.
Oh no, I didn't mean it like that. No,
Okay, I think when the officers go out, they complete the domestic abuse or harassment, the dash form, and they record it in terms of the information that they've got. I think in terms of work that MATAC does around those serial perpetrators, because it's not high, it's the serial, that should draw some of those out. But that's only a part measure in terms of the support and the wider support that we need to give to victims to make sure that they get that. So the repeats and what we need to picking up on.
So, but I mean, so the other thing though that I think is interesting is the nature of abuse perpetrated by the men, not always men, but largely men, and that is that very often a relationship is blamed for the abuse, so it's a toxic relationship, or it's a this or a that, but actually it is a perpetrator that very often has a history of abuse in the past that is just continuing a pattern of behaviour, and it's dealing with the perpetrators as much as it is supporting the victims.
Same as stalking.
Yeah, it's the same with stalking, exactly.
Definitely, and that's why there's the real good evidence base around MATAC, because it's the perpetrator. Actually, if we can stop the perpetrator moving on to an next person, that stops 2 victims, as opposed to just one victim. So it's that multi-direction approach to tackle them, and that's what we need to do. In terms of some of the challenges that we've got, when we talk about the offence that we're talking about, those high-risk domestic abuse incidents, stalking offences are PIP2, i.e. it should be investigated by a detective. Rape investigations and those complex investigations around modern slavery, human trafficking, they should be investigated by detectives. A challenge that we have is detective recruitment. That's not just a challenge in North Yorkshire, it's a national issue. We have got some work streams in relation to do that, and hopefully that might see an improvement in terms of those retentions and recruitment of detectives. We've touched on RASO outcomes already. RASO, for the viewers and those people who on the table don't know, that's around rape and serious sexual assault offences. So yes, North Yorkshire Police have got a good outcome rate compared with the national average, but we've still got a long way to go in terms of increasing that as to where it should be. So there's some work that's been completed, and I'll come on to those later on. Nice to touched on, we haven't spoken about hate crime. We've now got a hate crime coordinator that's been recruited. Some work's been ongoing with citizens' advice regarding them being a third-party reporting centre. So we're getting more details from communities that might not normally come forward to report incidents to us. They are flagged within our systems, our IT systems, so we can identify perhaps which groups we need to work with and avoid those links, just so we get improved recording around hate crime and those victims in North Yorkshire. So, moving on.
Okay, sorry, can I just ask a question on that last point there? Because obviously on the previous slide...
On the training?
Yeah, on the training. On the previous slide you said about how there's a really strong understanding of vulnerability across the force. Can you provide some reassurance around how the developed understanding that we're getting through the work that Nexus is doing, through all the work that's been done around modern slavery and all these different areas, is actually getting fed through, and is it having any impact on the way officers are trained when they first join, are they being continuously updated on that? Are we seeing some change in the way that we're actually helping officers to identify vulnerability rather than just providing them with briefings? Are we actually training them differently?
We are, but there's not that, Tom, and I'll go through it. So previously, in terms of the student officers, those officers that are just joining, the inputs that they've received around some of the areas of vulnerability are being provided by training services. They follow the College of Policing requirements to train those officers, which is right. But in the last 10 months, we've changed that. So instead of people from the safeguarding team going in for an afternoon or a day to give them an input, we've just changed that around, so actually we go in for the entire week. So the recognised leads within my team go in, so somebody will go in for an entire day to talk about domestic abuse. So not only what domestic abuse is, what they need to look for, the reasons why they need to complete the forms and how they can support victims. And actually through some work that we've done recently with a victim, at the next course in March, a victim's coming in to speak about the coercive and controlling behaviour that she suffered when she was in a relationship. So we've changed it. So actually instead of people delivering it from a classroom basis. We've got frontline experts coming in to deliver that as subject matter experts for the day. So that's around missing from homes, really important around the exploitation of children, county lines as well. We've also got people coming in around modern slavery, stalking and harassment, domestic abuse. So all those areas we're now going and deliver that across the week, which is a real change. And that's been received positively from both staff and the officers.
I can imagine that's really good to hear. And is there any way of understanding, obviously that's a very intensive kind of period of time, is there any way that we are trying to understand whether, because obviously one of the outcomes that we were looking for in the fire and rescue, the police and crime plan was that excellent understanding and compassion around vulnerability. Is there any assessment being done of whether officers are retaining that understanding and knowledge down the... So obviously if it's only just started, this kind of reinforced...
So that's 6 months
started. Yeah.
Okay. In addition to that, we have a number of national e-learning packages that officers do. And we're monitoring compliance. So, yes, some people don't like it, but
it is awful.
They've got people who've got different learning models themselves.
That's a good way of putting it out.
Thank you. Others don't. So actually what we've started to do, even in the last 12 months, we've got people to do videos. Actually, a 5-minute video is the importance of stalking and what those risks are, so that it's getting it across in another medium. And we've also developed a number of toolkits around missing from home, modern slavery, human trafficking, so officers can have that in the bag on the laptops.
I think they've struggled though around the quality of the human trafficking and the slavery stuff, haven't you? Around some of the quality of the training materials, so I understand.
I'd like to know where that's come from, because that's not the feedback I've been given.
So right.
if that is the case, more than happy to discuss that outside.
Okay.
Or here if you want to. But actually, because we've been told the toolkits have been good. We've had feedback from the National Crime Agency about them and HMIC around them as well. So I'll be interested to hear that. And if it needs to be tweaked, we will do.
I don't think it's necessarily just a North Yorkshire problem. I think it's a wider issue actually around some of the quality of the training materials. But anyway, that's a...
And I think in addition to that, it's been sort of proactive around development and given further bespoke training, if you like, with the officers. So there's quite, again, and continuing sort of culture that we're dip sampling certain investigations, looking at body worn video as a feedback type of tool, which again is that, you know, kind of, I think that real value type of training as well that we can continue to individuals. So I think it's a number of ways, as Alan said, that actually it's not one size, certainly not NCALT, that actually is how people learn in different ways. So it's that recognition and that continued. Certainly since the time that I've been here, we've got that. We've got the Strive and Thrive type of tools as well. So there's an awful lot of ways that we're able to really understand how well people and how the training is landing.
Yeah.
So that's the important part.
I mean, the thing that strikes me as the mother of teenagers and somebody at university now is the way that young people learn is so different, and so the new recruits that you're coming in are used to learning in a completely different way. You know, Quizlets. You know, it is just a completely different way of learning. Lots of video-based stuff. It is, you know, and policing generally, I think, has work to do around this.
You know, one of the initiatives that we've completed in the last 4 months was our podcasts. You know, just a 5-minute podcast around a subject, so people can download it. We've shared those with partners, and actually, it's just thinking about all the different ways to get that message out,
and that's
repeatedly.
That's going to continue. We've got digital learning technicians, I guess, in learning and development and training now, coming up with videos and packages to be able to quick clips that people can have a look at.
And can they use it on their devices then?
Yeah.
Their mobile devices, right? Let's not go there. But
if they have a wonderfully supplied mobile device, then yeah, absolutely, they can use it on there. But we still have an HMIC recognised when they come in that we have embedded Thrive, regardless of the control room piece, on the front line, because it's quite simplified. The V is huge and it's red, and it's because it's around vulnerability. And it's basically teaching the officers and PCSOs on the street what our fire service colleagues are doing. Don't walk away. don't walk away until you've actually
Be more
dealt
Brian.
with. Yeah, I mean, the way it's
Be more Brian.
be more Brian.
It's a good phrase. Hashtag be more
Yeah.
Brian.
But that's what we're telling people that before you walk back down the path of that domestic, leaving the offender, the perpetrator and victim still there, have you done everything you can to get rid of any type of circumstantial or situational vulnerability? And that is embedded throughout, and that's one of the key things that's here to stay.
So just on the back of that, something Alan and I have talked about in passing, not in any great depth, and I've mentioned to Annette and Phil, but we've talked about at length, but never properly progressed is, and there's an element of it already, but the victim input into this, especially around things like stalking and domestic abuse and some other things. And just whether, given the sort of digital element, so I'm very conscious of bringing victims in to give a physical input is a one-off thing, because you can't be expected to do that every time, but there might be a way around filming or podcasts or whatever to make that a continuous thing, then that can be...
And certainly when that lady comes in, it's going to be filmed, because actually it's right that the other people across the organisation are able to see that and understand the impact, because when you've got a victim telling about the impact that incident had on them, or the impact that our response, or at times poor response, has had on them, is really important. And people are more likely to remember that personal story than the text. And that's what we need to do.
All right, we are going to have to motor a little bit now, aren't we?
Okay, so the opportunities that exist to overcome some of those challenges, up to MACE, which is the multi-agency child exploitation meetings, have now been embedded, both in the county and the city of York, which is really positive. And that's talking about those children that are being victims or suspected of being victims of child exploitation, child sexual abuse, missing from home, and that's being really positive and getting some results in relation to that. MARAC, the multi-agency risk assessment meetings around domestic abuse, they used to be held every fortnight or monthly, depending where they were in the force. Actually, we've now gone to what we term as daily MARACs, but they're actually twice weekly. We've piloted that in York, some really positive feedback. We've had a peer review in relation to that, and because of that, it's now been expanded across the force area, which means we can get to the victims to provide that more enhanced support around them, multi-agency as well.
Now, on that note, sorry, I know we've got to be quick. You might know this than me, I've not checked in for a while. The stalking clinic, it was Police Reform Transformation Board, but it'll be something else now. With Cheshire Hearts and the Met.
Yes.
Has that come to an end yet, and is there best practice? Is that a formalised?
Still on at the moment, but I think the money does run out at the end of this
April.
beginning of April, end of March financial year.
Because I know there's you've been sort of, I think, been one waiting for the sort of formalisation of that best practice to come out so you can move forward. I just wonder when that might be, but we don't know yet.
I've not had a chance to speak to the superintendent in charge over at Cheshire in terms of what their plans are moving forward. Because we're interested to know we've had some results in relation to that. And we've talked about our RASO outcomes. We've created a rape scrutiny panel.
Who's on that then?
So it's chaired by myself. CPS are coming. Our RASO gatekeeper are coming. One of the DIs on air will be, and that's just around the investigative standard. Okay, but that's going to be closely linked to some of the work that Sarah Arnold's doing commissioning wise around the strategic group that she's created, and we're having conversations yesterday in relation to that, so that they actually are joined up, because I think one of the things that we need to make sure around some of the rape requirements is that actually there's the victim support, there's the necessary services for victims, and Sarah and I will discuss that yesterday.
So, okay, so that is something that probably does need to be scooted up to the LCJP, because...
So we discussed that yesterday with Sarah.
Right.
Okay, because I think Sarah's view was the reporting and the governance around it. And my view was actually this is probably best going into the LCJB, because actually that's where it's going. That's where the outcome is at the end result, the judicial result.
Duplicate the domestic abuse and rape panel. That
I can't remember the name of the officer who contacted me now. Who's been
Simon Turner.
Simon. I knew it was a Simon. There's too many Simons at the moment. I had a conversation with him the other day. No, I'm going to have a conversation with him because obviously we've got the domestic abuse and rape screening panel. It hasn't focused on rape to a great extent so far, but my conversation with him was going to be more about how we might be able to, because I know what you're potentially doing is on a very specific case-by-case tactical basis, but in terms of the actual scrutiny of it, whether we look at the way in which we improve the work of the domestic abuse and rape panel, scrutiny panel, so that it can.
So it might be
Take place
worthwhile thinking about the names, because the names are a bit confusing. So that is more, sounds like that's more like a rape review panel as opposed to a scrutiny panel.
It would be reviewing those rapes
Yeah.
and getting that scrutiny out understandably. And I think because it will be around RASO, actually very different, or separate I should say, from the domestic abuse. I appreciate there's some crossover between the two, but actually it's to keep them separate, but aware of the work that's ongoing.
Well, I think it needs. Tomo, you'll pick this up, won't you? Because you're going to run into difficulties around duplication if you're not careful, and misunderstanding of what each one does. There is also the national review that's going on at the minute, which I understand is not progressing that well, largely around CPS issues. So I'm particularly keen that if we've got the CPS engaged at a local level properly, I think that's very positive, because at a national level they are not being terribly forthcoming about being open to scrutiny.
And I think, because I know CPS have their own rape review
Yeah, but they're marking their own homework all of the time, aren't they?
And so actually,
Well, they are.
yeah, that's a statement. And actually, we want to make sure we can get more cases to CPS, and I think that's what I wanted to.
Well,
achieve.
that's got to be specific. So that's I think that is a very specific. I just think it's the word of it.
Okay.
The name of it is slightly. Yeah, but that's fine.
But
But if we've got that at a local level, that is really good, because at a national level, it you know, it's not happening. So.
in terms of recruitment campaigns, there's a number of campaigns going on across the force in terms of PCSOs, specials, police officers, and also detective transferees that will be coming as well. So that will help us, I hope, address some of those detective gaps that we've got and the challenge that we've met before.
And just on that, I mean, I think the force has done a tremendous job on getting on recruitment recently. I mean, really excellent job.
One of the things that we continue to do is horizon scanning about what's happening in other forces, what has been commented in other serious case reviews, lessons learned reviews, HMIC reports, so that we can identify best practice in other forces, review our policies, procedures, and adopt them where that's appropriate to do so. And we continue to do that, and that's something that we want to try and expand with that. And of course we know that we've got the targeted operating model work that's been completed, which may address and give us some opportunities in the future as well. So the areas that we are pursuing and areas that we want to develop, we've got the new control strategy that's been discussed. We've also got now service plans for each of those areas, which are really important because that's allowing it to be delivered and driven at the front end as well. We've now got a polygraph officer appointed. They're on their course at the moment, learning how to use the polygraph equipment, which is a real positive step forward, using technology to identify the risk that some of our sex offenders use. And I hope from that there may be some opportunities to use that for some of our stalking offenders as well in the future, which will be good news. We've talked about the domestic abuse prevention, early intervention, so don't propose to dwell on that if that's, unless you want to discuss any further with it. But specifically around domestic abuse training, I think that wider element about the refresher training within the force, yes, we've got it right, we've changed it at the front end. We've put out some new documents, we've put out training messages, but actually we need to have a look at a way how we can retrain those officers that have perhaps not been in the classroom of domestic abuse for the last 5-10 years. So there's some opportunities around that, and I've certainly discussed that with Rena in relation to how we can achieve that. And I think the other two areas that we've already spoken about in terms of that. So what are we expecting to achieve in the next 12 months?
The very last thing, I know you can't do everything, Alan. Nothing about stalking on that list. But I'm being pedantic, so I know it is an area of interest, but...
I think...
Move on, we can talk about it afterwards.
There isn't, but I think in terms of the training that we're trying to achieve, we know where we're going to go with that. That's certainly not disappearing. And I think in terms of, we still want to work with that.
So I just think it's probably worthwhile for the benefit of the public saying why we keep asking about stalking, because it's deep. Some of it is that we have had and continue to have concerns around understanding of stalking. It's one of the things that we get into the OPCC most often from members of the public who feel they haven't had a good enough service, and that's and when we see repeated concerns being raised by the public about the same thing, that nearly always tells us that there is an issue within the service, and that's why we're focused on it.
And you know, I know Will and I speak regularly
Yeah.
about stalking and some specific cases.
And we know that HMIC has not been kind to forces around its ability of stalking either.
Yes, because they've done their thematic review on it as well.
Yeah.
I think
Anyway, we can move on because we
it's not
really
lost
do
and
need to
it will
move
be an
on.
objective for the future. So what we want, the results-wise for the next 12 months, managing offenders with partner agencies, with other law enforcement agencies. We've increased charge rates around RASO, which is really important before we achieve that. In terms of domestic abuse, reducing the repeat rates, so we're picking up on Tom's part about those repeat standard risks of domestic abuse. We want to reduce those, because actually that continued effect on that is that coercive control behaviour. If we get those repeats, actually that's what we need to be picking up more effectively. And also reduce the attrition rates when we get those to make disposal decisions and taking cases to CPS. And also, of course, developing existing arrangements around safeguarding children. There's development work in York and also within the North Yorkshire County Council about how we can support those children, because actually the children are our future, and if we can make them stronger for the future, that's what we need to do.
Okay, brilliant. Now we have 15 minutes for the rest of the agenda. So what I might suggest, if that's all right, is on the performance reports, if you go through any exceptions,
Yeah.
if that's all right, and the same.
Absolutely, that's what I'm going to do.
Yeah. Okay. Are
you?
you're first? Yes,
Yeah.
if that's
So-
all right.
So I will go through as an exception. report,
Yeah.
as you said.
Yeah.
Oh, no.
That's fire. Do you want me to go through it first? I can go first.
Excellent.
There's nothing dramatic in the fire data this time for December. Sadly, we had one fire death in December, which followed a fire death in November as well. So it was a poor end to the year, really. There was a fire death at the end of December, the 28th, at Eggborough near Selby. The only other thing that really stands out for me in terms of the fire statistics, and something that I'll follow up after today, is in terms of the difference between accidental and deliberate fires. In every one of our districts in York, except for Selby, it's much more likely that they're accidental rather than deliberate, whereas in Selby there's a higher proportion of deliberate fires than accidental. The numbers aren't huge, but it's something certainly that I can pursue with Andy Blades, the district group manager, to see what we're doing in Selby about that particular issue. Going on, today's theme is caring for the vulnerable. So when we break down the types of household that we're getting into to do our home fire safety and safe and well checks, about 2/3 of them are in households where the occupant's over 65. About 1/3 of them have no working smoke alarms, and given that a higher proportion of households have a working smoke alarm than that I suggest we are identifying some of the households we need to get into. Because if you don't have a working smoke alarm, statistically, you're something like 6 times more likely to die in a house fire than somebody who has got a working smoke alarm. Partly because of the alarm, and partly because of the behaviours of the type of people who have a working alarm compared to those that haven't. About 1/6 were in properties where the occupier would struggle to escape, which again is high risk for us. And will be more than the proportion of households that have got somebody who struggled to escape. About half of occupants lived alone, and that's one of the identifiers for people who are more likely to die in a house fire. And about 1/7 of properties had a smoker in them, and smoking and cooking remain the 2 higher causes of fires.
I wonder how many tick all those boxes, but anyway.
Yes, absolutely, perhaps. And also, what's really crystallised in my mind during this afternoon is that I have spoken about not being so concerned about the number, the volume of home fire safety visits we do, but more about the quality. And I still stand by that, but actually every household that we enter provides another opportunity to find a wider vulnerability and share that with other agencies. So there is something about balancing properly the quality, but also getting into as many houses as we can.
Can I ask for something for
Go
next
on.
time, and then ad infinitum, which is on the home safety overview? We've got parts 1 and 2 sort of lumped together. Can we separate part 1 and part 2?
So can I just sort of say a wider point on that? Is
Yeah.
that these decks is something I know you're working with Fiona
Yeah.
with. So if you want to feed comments back through to Fiona and go through that process, that would be great.
But I don't think that'll be a problem at all.
Yeah.
Health and safety overview, there's nothing startling. Neither is there anything startling in absence levels. The one that people might ask questions of is the long-term sickness for on-call stations. Looks as though that data must be wrong. 31 is a lot. The reason is that each of those stations, apart from Tadcaster, has had one person on long-term sick during the whole of December. Hence, it adds up to 31 days exactly for that month. Tadcaster had a second person who was on long-term sick from the 3rd of December and on to the rest of the month. So just to answer any questions that might appear odd. There's nothing dramatic. We remain in the lower echelons of sickness levels for fire and rescue services, which is a really important indicator of contentment within the organisation. But what I'm going to focus on, because during December and this month, just anecdotally, looking at the daily incident log, receiving phone calls about serious incidents, it felt like there was a spike, an increase in the number of deaths and road traffic collisions. And just today I've got the data through, and it is definitely worth sharing, particularly in light of what you spoke about at the beginning of the meeting and the road traffic collision deaths we had at Skipton over the weekend. So in 2018, in road traffic collisions in December, there were 2 deaths and 8 seriously injured. In 2019, there were 10 deaths and 11 seriously injured. But the number of road traffic collisions was broadly similar, 44 in 2019, 42 in 2018. So the severity of those incidents in December, just gone 2019, was far greater than it was the previous year. I suspect by the time we get to the end of this month, those figures will be exacerbated again by the fact that we are having another month at the moment of higher numbers, and that's something that we're going to have to explore to find out whether this is an outlier, it's just an unusual month, but the devastation caused by these is just goes
And no doubt,
so far.
John, as new chair of the 95 Alive
Yes.
group, will take that forward to the Road Safety Partnership.
Absolutely.
But I'm pretty sure from memory, looking at North Yorkshire and York across the patch over a long period of time, number of accidents are similar, but the number of deaths are going up for whatever reason. I don't think people know that yet, but I know the government are also growing more concerned about. Generally, that number is plateaued a long time, and now it's going back up the wrong way, having come down for a long time.
So I'd caveat this, I haven't QA'd these yet, but that's what I got through from the data team today, and that shows a worrying increase in the severity of
One of the problems with road safety stats is they take a year and a half to come through because we haven't even had last calendar years finalised yet, I don't think, formally from the Department for Transport, so there's a long lag.
It'll be interesting to see how we compare with other parts of the country as well.
Okay, great. We are going to...
Yeah.
Thank you,
That's me.
Andrew. Thank you.
Is that clicker?
Sorry.
Oh, sorry.
Thank you. So just in relation to mental health, we had one person detained in December under section 136 that was brought into custody, and that was because that person was assaulting a PC because of the violence nature. He was taken to custody. We did have 7, which was higher than normal, that presented with mental health issues whilst in custody for other matters. That was taken for assessment, so that is slightly higher. Obviously we had 4, so again it's just something that we need to monitor, but they weren't brought in for 136.
But that does beg a whole range of questions, doesn't it? Sorry.
No, so I think this change in how this table looks is a result of my meeting. Well, this issue came up a long time ago. It took me a long time to meet the head of custody, which we've done now, a couple of months ago, of which I don't think I'd realised the nuances around different types of assessments in custody and when they get done and how they get logged as a detention or not. And hence that new line at the bottom, which is the number of assessments done once someone's arrived, and then they get designated as something. So there's more to learn around that. It's on our radar in the office, and Polly's going to take some work forward on that front. So we're sort of across that to a degree, knowing it's something we need to look at further without making any second guesses as to why or what should happen as a result.
Okay, so the again, come in if there's anything from there, but I wanted to believe that domestic abuse was discussed at the last PAM around the reduction in incidents compared to last year. I think someone may have alluded that it was potentially because of the World Cup and unusual hot May, and that was proven to be correct, that there was a significant increase in the May, June, which actually reflects other areas nationally. So there was seen to be the decrease in incidents. However, there has been an actual increase, going back to our domestic abuse theme, of recorded crime or committed crime. That is because the way that, again, we are recording better, making sure that the crimes are recorded as well, sort of separately in relation to that. So that is seen as something as a positive in terms of making sure that we're accurately recording those crimes. Is there anything from that, Alan, that you need to come in terms of the increase?
I don't think so. I think what you said is right, and I think probably just linking the bit that I touched on before about the primary reporting of crime and the secondary reporting of crime. So if they identify it's an offence of stalking, actually there might be some secondary domestic abuse crimes that are identified as well.
And that's it. And just to reassure that the stalking and harassment, the separate nature of that is absolutely a priority at the moment within the Ops Board. So we're doing an awful lot of work around understanding that, right from the incidents that may come in as malicious communications. So our understanding is really, really improving on that. So that is factored, just to reassure you as well that is the case.
Can I just... go.
The thing that stuck out, and I don't know the populations well enough, was how similar numbers Scarborough and York are, when you'd imagine Scarborough being smaller population size than those two.
So I think the more useful statistic there is per head of population as opposed to the absolute numbers. So just wonder whether we could do that, because that gives us a...
Yeah, well, that's what I'm
yeah.
Right. Okay.
Rurality might be interesting.
Well, I know, so it just might be quite interesting.
In terms of general themes, again, we're continuing to see the reduction in ASB. So again, but then the increase in violent crime. So again, we've talked about that previously around better crime recording, more accurate in relation to that. I'd just like to take you to the force control room.
Can I go up a slide to
You
proactivity? There's a divergence in July between RPG and FSU, and I didn't know if that was something happened within those teams at that point, or they've just been deployed in different ways.
You mean the proactive hours undertaken?
Yes. One's gone almost identically up and identically down in the bottom right hand box.
Yeah, there's been we've had various different drink drive campaigns, etc. when we go into the dark months up to Christmas and stuff like that. That could be a little part of it. The wider picture of it for me around RPG is that we've not got enough in terms of proactivity out there, in terms of that specific skill. We do have advanced drivers within some of our task forces and our firearms capability, but keeping people safe on roads, having that visible presence, slowing down drivers, stopping people, pulling them over, breath testing, etc., is something that I think that we need to do a little bit more concentration on, based upon what we've had over the last few weeks and very recently over at the weekend. That's something that I'm particularly going to look at the moment, to address that balance of we've got a lot of work for civil security crime and that road-related crime attached to county lines, etc. But as part of our control strategy, that's a focus. but people dying on our roads is unacceptable, and we need to look at addressing that balance, and that's something I'm going to be looking at.
Great, thank you, Mike.
So in terms of 999s, we've continued to see the increase in 999s. This is a national picture, and in line with that, and a reduction in 101s. Far as we have improved from the summer period, our answering time, and so that is an improving picture, and particularly now we have recruited the number of call handlers that was necessary to deal with that demand. That's ongoing, so we're not there yet. So again, we will see that hopefully as an improving picture. And just skip into the people management in relation to sickness data. We did see a decrease in December. A lot of our sickness is long-term sickness and better management of that. So we've got a plan in place, particularly around education. The first, our line managers and supervisors, to make sure that we put those prevention support interventions at the earliest stage. But it is still a concern because we are nationally quite high in terms of sickness, so it's not good enough. But I'm satisfied we have now put in other structures, more of a robust people monthly management meeting, so we're really being able to scrutinise and make sure that we've got those plans in place to reduce the length of time people are sick, but obviously continuing with the people and the human factor within that.
So it's interesting because the psychological element of that seems small, doesn't it? And I do wonder whether sometimes people say that they've got a physical problem when actually it's something else.
So I think, we've had higher officer assaults. They've doubled over the last 5 years. We saw over Christmas we had an awful lot. And the worry for me when I look into the future is, we've had fractured cheekbones, broken fingers, lacerations. They all heal to an extent, but it's the psychological impacts of that moving forward and the PTSD.
Yeah.
It's not nice what some of our officers are having to deal with, especially on their own sometimes in those rural locations. It can affect you, it can make you lose sleep. This is why we need to really focus on that as well.
Yeah, absolutely. Okay, great. All right, I think we've got some questions, Simon.
Can I just very quickly, next time, the recent stats that were out from the ONS had some good news, some bad news around highest increase in burglary in the country and things like that, whether at the next PAM there can be just 5 minutes on that and the response from the force to some of
We're also due to have a deeper dive on drugs and drug offences.
When?
Drugs this time around.
Oh, will we?
But I think it's slipped. So
it's not on the agenda.
No, because it didn't appear. So we'll pick that up for next time.
Well, maybe those two things.
Right. Okay. Fantastic. All right. Well, thank you, everybody. Simon, did we have some questions?
We've got 2 questions.
Yeah.
We've lost the screen at the moment.
Yes.
Oh dear.
Did you want your domestic abuse per population head?
Yeah, per 1,000 people,
Yeah, there you figures.
So what I'll do is I'll bring the laptop to you because
Is the laptop connected to the internet? Can they still see?
no, we'll have to put them on later.
Okay.
After the meeting.
Okay, that's not going to please one of them.
Yeah.
Well, we've been having
Some of the rural areas are really low when they should all be the same.
Okay.
It doesn't have to
So
be.
that's one, and if you push it down,
Okay. So can I just? So, in which case, so we're not live now.
yes, yes,
We are live.
Yes.
So can people see the questions or not?
No, they can't.
No. So shall I read them out then?
Yeah. That's great.
Okay. All right. Okay. So we've got a question here from a GS Swinburne. Hi NY Scrutiny. It seems that we have a range of individuals making permanent homes in shop doorways in York. I'm told each one has declined offers of accommodation If that is the case, for them and us, why are they allowed to stay permanently in shop doorways?
That streets, is that sleeping on the streets? Is that
Yes.
Yes, this is the homeless.
Yeah, in York. Yeah. Do you want to answer that now, or do you want to write a written response to the
I
individual?
think it'd be useful to write a written response to the individual.
Okay.
Bear in mind, I understand what they're saying, and that is something that can be an issue at times in terms of.
It's not just a policing issue either.
No.
What's
No.
worth noting as well on Twitter, further through the thread, there's reference to money being provided by the government nationally and a proportion of that coming to us. So I think there's probably more to this really important question than just that, and a written response might well be more appropriate, and then we come back to it next month. Is that how it happens, really?
No, we publish them online.
No, we publish them. But also, I mean, this is a major issue of concern in York. I mean, it just, I mean, actually not just in York either, but in other places as well. So I think it might be helpful to try and obviously we need to talk to the council and you know, all of the rest of it to just try and get a full response.
Just worth noting at that point, you've community funded a project in Harrogate where you can pay some money that goes directly to the homeless service.
Yeah,
which is good.
It's good. You just zap it outside Marks and Spencer's and donate £3. Okay, the next one is we would like to know why the Police Commissioners Fund is only looking to fund new projects and initiatives as they're already in provision in place that needs support. We don't just look at new projects and initiatives, we repeat fund a range of different things, but if there is provision in place that needs support, then people can come and talk to us about the fund. I mean, it sounds like somebody may have been turned down there for an application. I don't know the circumstances around that, but certainly we can find out.
If it's the community fund, I mean, one of the sort of goals is it's sustainable, so it can't be a forever funding model, but it can do multi-year, but we do have to be slightly careful about making sure it's a sustainable model.
Yes, in actual fact, we will, I think, be looking. So there are organisations that have had funding over a number of years, and we are looking at how we support those organisations because they need to be supported, and so we'd like to give them more permanent security around their funding. So, you know, particularly in Scarborough, so the Street Angels, for example, in Scarborough. Okay, so, but yes, if anybody's got a particular issue around the decision on a notice, on an application, then I'm happy to have a look at that. Okay, thank you. Right,
Thank you.
that's it. Unless anybody's got anything else? No. Well done, everybody. Thank you very much. Thank you.